Okay, so good morning, everyone. I welcome you all to the second day of our webinar session, that is Zoo Animals Veterinary Care and Management. So today our first speaker would be Dr. Madan Kompal, and he would be discussing his first talk on would be on zoo animal surgery and diagnostic imaging. So over to you, sir.
Good morning, everybody. So I welcome all to this wonderful morning, and with no time, we'll go for the presentation topic today. So it's on zoo animal surgery and diagnostic imaging. So we had two sessions today, like two topics in a session, third session. So that is zoo animals diagnostic imaging plus zoo animal surgery. I'll be taking these topics together, and we'll be looking into the surgical cases and how we diagnosed it and what are the modalities used and how was the case presentation. So from the presentation of the case till the surgical aspects and the healing of the condition. So we'll see all together. Okay. So first, let us see the avian sections, like the bird category of patients from our zoo. So you see in this case, you can see a male Saurus crane with a broken the beak. So he was a potential male in our group. So the the uniqueness among the Saurus crane is their sex ratio is 1:1. They live for each other, like a male with only one female, and the female will be with only one male. So in that case, so this animal, the male, so he broke the uh, the beak in a infighting injury, like with the other male in the next cage. So so this had made him the completely half fit for 3 days. So we tried to fix him with slight like splint application, but it was not fruitful. Okay. Okay, you can see clearly the broken side. See both the upper and the lower beak fragment has been broken. This is the X-ray the radiographs of this beak. So you can see at the right hand side is a lateral aspect, and the left hand side it is the anterior posterior view of the radiographs. So coming into surgical aspect, so now the animal has been sedated, the bird has been sedated. Then the local adrenaline and also the lignocaine has been given to arrest the bleeding as well as for the numbness. You can see now we are debridating the fracture site. Again, in this site, we are still infusing, like top upping the drug required for the local to arrest the bleed. Considered doing the microplating. So, see, this is a microplating. So, two plates has been used to fix this. But the uniqueness among them is, see, the plating with the acrylic bone cement on the top of the plate. You can see like the anatomical nature of this beak is, so only the surface is hard in nature, and completely the inside the body will be completely it's a vascular section, like there is no holding capacity, like there is no holding strength for the screws here. So we suspected like this might fail, or this might there might be some the deviation of the broken fragment in future, but what we expected that happened. Then we considered fixing it with the external splint. That is for external skeletal fixation actually. You can see in the first photo, like we're considering this, and we made a customized design to uh, design for the broken beak for the fixation. In this video, you can see that two fragments has been fixed, the upper and the lower fragments. So this hinge design has been made to counteract the pecking action, like there will be force on the fracture site. The bird tend to prick on the hard objects. So this hinge will take care of that shock. It will absorb the shock. So that's the nature of this. Okay, you can see the upper fragment and the lower fracture fragment has been held by this metal object, which has been again reinforced by the bone cement. See the what are the fixative material? The implant has not has gone into the lumen. It has been externally fixed with the help of some groove made on the either side. The is the radiograph, again the lateral and the anterior posterior view. You can see here the fracture fragment has been held in a proper position. So immediately after this fixation, the external skeletal fixation, see the bird felt so comfortable in feeding. You can see animal is able to pick up the shrimps served, as well as it was feeling very easy, like comfortable, and routinely it was drinking on the milk, sorry, the water and even the shrimps. So on the day of removal of this plates, the plates was removed like 45 days to 50 days post-operative. So you can see here how we are projecting the bird, and I want you to look into the person who will restraining the bird at the left bottom corner. Animal has been held with his limb and the body, and I am projecting the head to the radiographic plate. So this is the processing of the radiograph in digital radiography. So the post this X-ray, this radiograph has been taken like about 30 days later the procedure. So this is post procedure, post removal of the external skeletal fixation. This is the day of release. You can see animal has split feet. So this is the female, the couple of the mate of that bird. Okay. So let us go into next case. This is a emu. This 1 month old emu bird, the chick. You can see there is congenital abnormality. That is the tibia has been rotated laterally. So which was this problem was aggravating day by day. There's a lateral projections. So you can see on the left side. So the both the limbs has been extended. So keeping the metatarsal and the tarsus as in a symmetrical way. But on the right hand side, you can see here the stifles has been fixed. So you can see clearly that you can see here the tibia is laterally rotated about 90-degree. The shaft rotation is congenital. So then we have subjected this for the surgical fixation. In this procedure, we created the fracture, we induced the fracture, and the fracture fragment has been debrided. And again, we fixed it in a right way, in a normal deviation, normal aspect by using the unilateral and uniaxial the external cylinder fixation. This. So is the projections. Because the bird was so easily, it was comfortable to walk around, and it took almost like 2 months for the complete fusion of. So let's see the barn owl with the fracture of radius. So you can see here the radius has both has been fractured. So in this we considered fixing this fracture fragment with the external skeletal fixation. So you can, if you focus on this, you can see there is fracture. You can see the fracture fragment here. So animal has been induced on both injectable and inhaled anesthesia. So this is post immediately like after the surgery, like this has been fixed with external skeletal fixation. And coming to Indian flying fox, again you can see that there is compound fracture. The bone fragment has been externalized, and there is necrosis of this highly infected bone fragment, which has been resected, and again it has been fixed with the external skeletal fixation. See, there is some gaping. This gap has been like maintained in order to keep the limbs, like the wings, in a symmetrical fashion. The kite, you can see here the left humerus has been broken. There is fracture, the transverse fracture at the proximal one-third of the humerus. Again, it has been fixed with the microplates, which is usually used among humans for the skull plating and even the mandibular and dental platings. So that those plates suits well for the avian fracture repairs. You can see dual plate has been used. And you can see clearly the screws has been introduced till the next cortex, and there was good opposition. And coming to the next case, the kite, again this individual had the supracondylar fracture of the humerus. You can see the condyle is here on the joint. There is supracondylar fracture, which was quite tricky, but we can repair this by using the rush pinning. So this has created like a very good opposition, and also the fixative, the stability of the fracture fragments and the fracture site was really well. So the bird was able to flap the wings like within like 2 or a couple of days. Again, we'll see another case from my zoo, like this is a flamingo. We own one large flamingo in our zoo, and surprisingly, this individual is 43 years old. And you can see in the limb there is some big lump. So this lump was there since 30 days or 35 days. So, but it has grown really very fast. Within no time, it has grown really in an enormous size. So that made animal so into completely lame. Like animal became so lame, and at one time, animal was not able to get up at all. So it's nothing but there's a fibrous material. So it has been plugged by surgical aspect. So it has been sutured. As the bird was so compromised, so IV fluids and the medications were given. You can see laser, we also employed the laser therapy on the surgical side. So both the limb were involved in the tumor. So we place the bird on the screen like this. So animal can feel the ground, but animal will not bear the weight on it. So like this, we kept the animal for almost like 15 days. Ultimately, we used to leave him on the soft flooring, and also so we used to do like once in 3 days. We used to dress the wound and do the laser therapy and all. The bird was so comfortable, so the feeding and the watering was kept right in front of them, like it was going really well. So this is the intermediate, like in the during the healing stage. So due to the laser and the healing activity was really well. So this is laser therapy. This is a laser therapy unit. So in our zoo, like we use it extensively for the wound healing. This is like post-surgical 15 days. The bird was able to bear the weight. So there was some discomfort. So which will be resolved in few days, next few days. So the bird came back to normal stance, like it used to feed again like the same fashion. Again on the day of release, so this bird was in our zoo hospital, the inpatient ward for almost like 45 days. So later on the day of release, so in this video one can visualize like how the keeper handles the animal. This is very important aspect. So the birds has to be handled or restrained in this fashion. Like it's really well. Our keepers are doing really well job. Okay, so next case is this will be about the Darwin's deer. It's again a big bird category. So he was about 8 months old. She was about 8 months old, and she had phalangeal joint dislocation. So we brought the animal. So brought the bird to the hospital. Um You see, this is how we took the X-ray. So restraining the head will be more. The animal will struggle more. So leaving the head free and holding the body and the limbs over the X-ray. So we felt that was the good method to go for the X-ray projections of the limbs. So in this video, you can see this is the induction. So he was on midazolam and ketamine combination. They was on. So this is the induction stage. The keepers they were surrounded the animal, the bird. So in order to like when the animal is going down, so just to support her. You can see the on the left hand side. You can see the we are taking the X-ray of both the limbs. It's just to compare um, the abnormality with the normal limb of the contralateral limb. On the right hand side, you can see the lateral projection of the affected site. This is X-ray. The first metatarsophalangeal joint has been the first and second phalangeal joint has been dislocated. It's a traumatic outcome. It has been fixed. Thus, soft tissue has been sutured, but there was an instability in the joint. Considered fixing uh, the dislocated site with the use of K-wire. See this K-wire here, it has gone into the bone and this has been held over the. We created the groove here in order to fix this the K-wire. So this joint will be in stable position. And we use the bone cement to fix this. But there was a severe compromise in the blood supply at the medial aspect of the digit. So we gave an option. We took a chance to see like if it uh, if it establishes the circulation, so the digit will be saved. If there is any compromise, then that will be like we have to amputate the fingers. The same thing happened. So after 1 week of time, the dislocated part was showing the necrotic signs. So we gone for the dissection and amputation of the digit. Then we'll see this next case, the adjutant stock. So again, this bird was about 40 years old. So this bird had a radius ulnar fracture, the proximal radius ulnar fracture. So it has happened during some fight between the birds within the cage. So into the cage and it happened. You can see here we are taking the X-ray of the fractured side. The animal is the bird has been held by the keepers. So you can see the bird body of the portion of the body is below the table surface, and there is the cassette here, the X-ray cassette, and we're placing this the fractured site on the for the projection. So this is the ML, the medial lateral from the medial to the lateral aspect. Again, for the induction of the anesthesia, we use the normal water bottle for the long elongated mask induction. The fracture fragment has been fixed by using the combination of circlage wires, the K wire, and the external circular fixation. You can see here there was multiple fractures in the caudal aspect of the humerus. Um, you can see we aligned the fracture fragments in a line with using this rush wire, rush pinning, and again fixed with the external circular fixation. The next bird, the grey hornbill. In this picture, you can clearly see there is some problem with the limb. So, in a secure way, we restrain the bird. Then when examination, we got to know there was a fracture. In this X-ray projection on the ventrodorsal aspect and again the lateral aspect, you can see there is a fracture at the proximal one-third of the tibia. This portion, again, this is here. The X-ray projections are very important to know the nature of the fracture, so that will aid in the proper selection of the fixative methods, and for the overall is for the proper healing of the fracture. You can see here on the lateral aspect, it's about like somewhat oblique fracture. Yeah. So there was there was the wound, and again we selected the external skeletal, like the external splint. We just applied one supportive rod inside, and again it has been wrapped with the cotton padding. This portion. So let's see. This is another beautiful creature in our zoo, the mandarin duck, which is considered as the most colorful duck. Okay, so on the left hand side, the most colorful duck here is the male, and the right hand side, this is the female. So our one of the breeding female in our zoo, she was limping, and when we examined the bird and we gone for the X-ray, we got to know there was a distal one-third fracture of the femur. So we can see on the dorsal projection, we can see there is fracture at the femur. The fracture fragments is measured for the fixation. So induction of anesthesia. So and in a standardized way, clip the feathers, like in a aseptic way, prepare the surgical site for the surgery. And draping is very important. Like so, in this we can avoid a lot of infections in the maximum way. And this has been fixed by using one K wire. We just pass it as an intermediate pinning. So in this image, you can see there is fracture site here, which has been held by the Alice. Okay. Then this you can see the rod here passing through the lumen of the bone, and it has been closed in a standardized way with the sutures. You can see the fracture site is here. This is the proximal fragment. This is a distal fragment. The pin is, we have left the pin about 2 to 3 mm. So outside the femur. A fracture fragment here has been fixed with a pin. So during the post-operative days, so all these small animals will be housed in our inpatient ward. So during the post-operative days, and again, if they have their mate, we'll bring them also. So she had the fractured femur here, this limb, and he was the couple. They were the couple. So we brought them together. And this video, you can see the female here. Concentrate on this female. This is the female. Now she was the one, like post removal of the rod, and this one she was able to, even with the slight limping, she was able to walk around. They're doing well and wonderful now. Even she was able to lay the eggs in the inpatient ward. So we'll see the next case, the river crow with the fractured, this one rescued animal, okay, rescued bird, which has a fracture in the distal metatarsal. And you can see this, we have fixed it with slightly on banding and with an external splint, specially designed for customized design on the spot. And it has been padded by the soft cotton. It has been fixed over this. Even this sort of methods for the non-complicated or simple fractures really work well on the birds, but one should make sure that the fixative, the external splint or this customized, which is prepared, must be in a very comfortable way. The animal must not feel annoyed by that the fixatives. So we should make the way for the animal to move around. Ostrich. So one of our ostrich, the left eye shown opaque discoloration of the lower eyelid. Can you see this? The lower eyelid, this is not the cornea. This is the lower eyelid shown the opacity. And if you concentrate on this bird, you can see there is opacity, like this, there is some discoloration when you compare to this bird. This is nothing but a third eyelid. The photo has been clicked, it has been synchronized with when the third eyelid flapped on the cornea. So the photo has been clicked on the right time. So we are seeing on this. So when we examined the animal, the lower eyelid was bruised and there was abrasion over the lower eyelid. So which has been, you can see here, which has been treated by eye drops on the application. So restraining on hostage for this cases are really cumbersome. It's a laborious work, but only the people who are experienced in handling those birds can handle them. So we have to be very thankful for them for making us to go near the animal and treat the animal. So again, this is from our avian section, the white ibis. So our limb, the leg was, the right hand limb was literally hanging down, like she was. She doesn't add the control over it, like a paralyzed limb. So when we gone for the X-ray, we saw there is dislocation of the femorotibial joint, the stifle. You see left position, you can see this. There is dislocation of this, and again. In the lateral projection also we can see there is overlapping, so the joint got dislocated. You can see it's paralyzed and there's knuckling, and the body is to stand on the left limb. So we subjected this bird for the surgery. We intubated through the endotracheal tube with isoflurane induction, and as a standardized way, we clipped the surgical site. And when we were exploring this, then we got to know there was a complete necrosis of the caudal aspect of the entire limb. There was a compromised the vascularization to the limb, and literally this limb was necrosed. So we considered for the amputation of the limb, which was carried out. You can see the mid femur and below has been removed. So this is the radiograph taken post removal. The only a portion, one third of the femur has been left in the body, and the closure of the surgical site. Hmm? ಏನು ಮುಂದೆ ಹೋಗ್ತೀನಿ. So you can see here the video, like the postoperative days. This bird was excellent. It was doing really the only limb, the left limb. So we didn't find any abnormalities. Then this has been released back to the enclosure. So next we'll go for the primate section. So all this time we saw about a few orthopedic cases and other cases among avians. So now we'll go into the primate species. So first we'll see about this chimpanzee. Um, this individual, she was 58 years old when we attended this case. Her name is Ganga, and she had an infight between other male in the group. So as a result of it, she had a laceration over the dorsal neck and even the perineal region, and even she had a fracture and the laceration over the paw. So she was literally sleeping in the pool of blood that in wildlife interventions, so we can't directly go into the case and handle the animal, restrain the animal physically and go for the treatment aspects. So when she is sleeping, when she is losing the blood, when the bleeding is going on, even then we have to consider the restraining by chemical means. So for the chemical beans, it will take some time. So that by the time there will be some sort of bleeding, and that has to be attended later. So sometimes this sort of approach might lead to it was inevitable, but this might lead to like if the animal loses more of blood, so that might be compromised for the life. She has been maintained on the injectable anesthesia as well as the inhalant anesthesia. So you can see here there was. Entirely, there was a slit between our vaginal lips till the anus, and okay, there were about 12 lacerations. It has been bitten by the other male in the group. So 12 lacerations over the dorsal neck, and here you can see there was a laceration, the bite injury over the paw. It is extending till the index finger. That is induced over the by the use of the mask, and this has been reconstructed on the limbs, and the time consumed for the porous reconstruction, because so you all know that the primates are the one which are very intellectual in nature. They sorry, so they have the capability to remove their sutures, and the mutilation tests are so high in case of primates, as we all know. But we considered the intradermal sutures and fixation sutures. No sutures will be exposed outside, so she will be not able to remove anything, and she won't have the access the option to access the sutures. You can see the stage by stage reconstruction of the lacerated the paw, and one can notice here. So there was the compromised tissue over the medial aspect of the index finger, which was already devitalized. Like there was no blood circulation for this. So leaving this entire portion open. So it's a very big question. So this leads to the infection, and also animal will definitely will mutilate the wound. So we considered amputation of this digit, so we can that facilitates in the complete closure of the wound. Okay, you can see we removed that finger, and the entire uh, the wound has been closed in a secured way. You can see here this is a suture line. Okay, we shifted her back to our enclosure, and we were monitoring closely about like how the wounds are healing. We even employed the laser therapy, the wound, the lavaging every day, and application of the antiseptic lotions on her. And left hand side, you can see there is the wound has been showing the healing tendency. And surprisingly, we noticed the animal cooperated really well, that she has not mutilated the wound. So this is a laser therapy attempts. Again, the laser therapy. So this, as you all know, like laser therapy is the one which aids in the healing. So application to the animal, like with a space between the wound, the affected area, and the laser tip. So the space must be about 2 to 3 inches of like maximum. So going so near to the animal is again a challenging aspect. So one should be very careful in doing this. Again, we're attempting to do the laser over the limb, the digit wound, the paw laceration wound. You can see she was so cooperative for our attempts, and she was very cooperative like the entire post operative days. On the right hand side, you can see that the entire wound has been healed with no second interventions, and there was no mutilation seen during the entire postoperative days. So the same sort of wound has been noticed in lion-tailed macaque someday. And again, this laceration compared to the tiny paw, it is very big. It was very big, and you can see that even all the digit flexors were lacerated and it was severed, and there was really a very big wound. So in entire wildlife surgery, if you spend the time for the surgery, the cleaning of the wound is a major aspect. Like if you clean the wound thoroughly, that will definitely lead into the complete or the wound will heal in a proper way with no second intention healing. In this picture, you can clearly see like how big the wound is. These are the flexors of the digits, which has been severed. It has been surgically reconstructed, but it is a questionable thing that how well it will heal. On the left photo, the entire the open wound and the reconstructed surgical wound. See the suture is passing all the way from the wrist. It is passing over the thumb, and it is passing by the over the middle, like the inner aspect of the index finger. It is passing till the middle finger. You can see it. And while doing this, we also noticed she had the fracture of the third metacarpal. Again, that has been fixed by using the intermediate pinning. Again, in always we leave some portion of the pin in order to remove it, like in the future days. Okay, this is operative videograph where you can see that there was a good healing, and even the animal was able to use the limb, the fingers and digits for to hold the feed and to entirely it was in the usage of this one. Another sort of same sort of injury. These are the reasons for all this is infighting, that the mates they fight and they will bite each other, and if they bite, the injury will be so severe. So cleaning the wound, as I told you, is a very important aspect. Debride the wound and go for the reconstruction. You can see like you can't see that the suture ends here anywhere, so animal will not be able to pluck or to access the suture ends. So this is another case where CPR, we perform the CPR over this tuft capuchin, about 1 month old the baby. So he was in a syncope, that he was really unconscious, but there was a feeble heartbeat and a shallow respiration. So we gave the thermal therapy, that we warm the body, we give the fluids. So within like few times, like animal really shown the improvement, and it came to the consciousness with the just with about 2 ml of dextrose normal saline. So the reason for this is the mother was so she doesn't add much of the mothering nature, so this individual was not given with the milk, so he ended up with this problem. And we reared him in the baby incubator for a few days, and he's doing really well in our zoo now. This other case in the outside facility, here you can see the Banat macaque. So there is a plastic thing like the brush, no human toothbrush cap is there in the buccal cavity, the left buccal cavity. It was very cruel that this animal, like the about 4 to 5 months old Banat macaque with this condition, that was opened here. Then we sedated the animal, we examined the oral cavity, and on the removal of this cap, we got to like how depth it was, and there was a literal and communication with the oral cavity to the outside. This is post surgery. Again, the same method has been used over the suturing of uh, the the buccal cavity, that in a layers of three, that animal must not have the access to plug the suture. So it has to be like always. Most of the sutures will be interdermal. So with this avians and primate species, next we'll go to the carnivore species. So first we'll see among the big cats, there's a tiger. So the tiger Chamundi, she is from another zoo from our state. So she has been referred to Mysore Zoo. She had a big lump in her lower abdomen region. You can see this was just, they took about 3 weeks to grow so big. Okay. So then it has been diagnosed as the lipoma. So with the help of the biopsy and also the use of ultrasound scanning. So that's been resected in proper, like in a standard surgical way. So this is our team with our doctors. So with our hospital team, and at that time we had an internist from the other colleges. There's a immediate post-operative, and this is a recovery room where she was just coming on her limbs. She's gaining the consciousness. So this type of motion is because of the ketamine action, cataleptic uh, motion set. So this tiger, she has been rescued recently. She is directly from the wild. So as you all know, the wild tigers, they will have the very aggressive nature and they won't tolerate the human interventions. So this is one of his sort. So this is one of the major challenge our team faced in Mysore Zoo. She was housed in the rescue house. So always, you know, that tigers, they tend to escape from the facility or the enclosure. So during that attempt, she had lacerated the arm region. So when we gone for the examination, we want to see where exactly it happened. And in the day crawl in the yard, you know, where this tiger was living, so we saw there is severe loss of the blood. Severe, like it is like most of like it was enormous amount of blood has been lost. You can see that how much blood has been lost in the when she was on in the ground. So we somehow the keepers managed to take her into the holding room so we can take the control over her. But by the time when she came to the room, she continuously it was bleeding. The radial artery was severed in the right forearm and was continuously bleeding. So it was a very panic situation, and it was really a very challenging aspect for our hospital team. So as we all know, when we dart the animal, see, she is in the room and we prepared the dart to make her sleep. And if you go and dart, for that also she will jump on us. She will get agitated. When she gets agitated, she will bleed more and more and more. Already there is severe loss of blood, and there was no. So we just took her into the room and we left her calm. After 5 to 10 minutes, we noticed there was no much bleeding from the arm. This is because she was silently settled at one corner, because even she will have the fear that the humans came because she was recently rescued. She is not into the humans. So next we planned in a step way that so there is no option for darting the animal and waiting for next 15-20 minutes for the induction of the anesthesia and taking her for the OT and going for the surgical reconstruction. So with the help of the keepers gaining their confidence, so with no time, so we asked them like we have to take only 2 to 3 minutes of time. We have to drive her into the squeeze cage. just squeeze her. I will access the tail vein and will give the anesthetic IV, like in IV route. So the thing went really well according to our plan. So this is see, you can see that she is slightly sleeping. We took the photograph from like nowhere, like she was not noticing her. You can see there is lot of bleeding all over the surface. It was very, very challenging situation for our entire team. You can see like the keepers really worked really hard in a very intellectual way with very good coordination. One created the disturbance to the animal ran into the squeeze cage, they squeezed the animal, they took the tail out, and then we injected the anesthesia IV. You can see when I gave the anesthesia on the other side, and I'm checking for the depth of the anesthesia. When I noticed this, everything happened within like 2 to 3 minutes of time. She was completely, like unconscious. So as the take her into the room, you can see here. You can see the how depth the wound is. The muscles, the flexor muscles of the digits has been lacerated, even with the major vessels. We took her inside. Even there was during this 2 to 3 minutes of time, there was enormous blood loss. So we can see a pool of blood below just below this cage. See, it was a very big wound. So this wound has happened because she tried to jump over the mesh construction, and she got it lacerated over some edges. So I was off on that day, but there was an emergency call. We rushed into the site, and with no proper surgical preparation, it was necessary to arrest the bleeding at any cost and to reconstruct at the same time. So after the reconstruction, I can see during the post-operative days, she was really doing well. We also planned for the blood transfusion, like we checked her hemoglobin level. It came to 6.2 or something. So it was almost like 50% of her blood has been lost during the entire episode. The surgical site has been clearly closed, and as you noticed here, the flexor tendons has been severed. The radial and the ulnar flexors has been severed, and others were intact. Along with that, the radial artery was severed. So no, so in these conditions, we don't apply any bandages or anything. We just leave the animal calm, and there'll be no humans going into the in and around the house, and she will be settled. You can see in this video, she will come from there, from the next room. There was some, okay, you can see she was really doing well. She has not mutilated the wound, so she really came out of that episode. But it's an unforgettable case we faced in our zoo experience. Another case, her name is Gauri, and she had the frequent episodes of shizzles, and we want to have a check on her. So we took the entire body X-rays, the radiographs on all possible views. This is a dorsoventral view, and the previous slide was the lateral view of the abdomen, lateral view of the thorax, and this is the radiographs of all of them. Okay, and coming to this tiger, his name was Macha. He was almost about like 8 to 10 years old, and he was actually the human killer. Okay, so he has been rescued, and we brought him into our rescue center, and within few days he has developed the hygroma. He had an abscess in the right elbow during the capture, but that has healed in some way, and it has grown, it has converted himself into like abscess mixed, like it is like hygroma condition. So this animal again subjected for surgery in a standardized way. We used diazepam and ketamine combination for the induction, and later it has been managed or maintained with isoflurane and inhalant anesthesia. And as we do on the domestic animals, the dogs, so say in the same way, the hygroma has been exteriorized and has been removed. You can see here our team and our staff always during the inhalant anesthesia maintenance. So we always keep the animal secure with the net. So this is quite essential, I feel. because when the animal accidentally, because the failure of the whatever the cause, like the oxygen or whatever, if the animal starts to move, then it will be very difficult if the if the animal is not within the net. You can see the planning, the thing with the keepers. Then there is the intubation. So always, I do the intubation over the big cats with the tactile method. And you can see the enormous size. You can compare, just compare the hygroma size with the hand size. You can just assume like how big it is. So it is some laborious procedure. It takes quite a long time for the entire removal and the reconstruction of the skin. And again, for the first 3 days, it is evident that we have to go for the bandaging of the site. Later, we can again go for the sedation and the removal of the bandage. You can see in the during post-operative day, the I was doing well with the phone. Okay, with these examples of tiger surgeries, we'll next go to the lion surgery. And this beautiful lioness, she came from Gadag Zoo. She had an open pyometra condition. So she came to our zoo. So she has been evaluated for the surgery, and even that she had some sort of like slightly elevated WBC count, and she was fit for the regular anesthetic procedure. So the sedation has been given through blow dart, and in this video we are seeing that she is trying to puke because the this is due to drug effect again, and she has been fasted for a day for the procedure. We planned the procedure and it was went really well. In this videograph, you can see I'm checking the depth of anesthesia. So always the wild animals, it's not so that you poke the body or somewhere and see that animal has slept. You can't confirm through that way. We have to touch the sensitive part. So always I prefer touching the now the fur which is in the ear. So this is a very sensitive part. If the animal doesn't respond for that, then I can say the animal is now gone for the depth anesthetic, the anesthetic desired anesthetic depth, and we can go for the restraining of the animal. We take the animal outside, we prepare the surgical site as in standardized way. You can see in the first picture we have intubated the animal, we positioned the animal for the surgery, and we draped the animal, and we initiated the surgery, and we removed the enormous sized the uterus filled with pus. The condition is pyometra. So again, the removal, like the suturing of the. So this is like, don't feel like this is the only suture we applied for the skin. There are 2 layers of intradermal skin sutures, and over that we will apply just to oppose the external portion of the. This is for the just for the reinforcement and for the security of the surgical site. So in this picture, you can see myself and our team with the help of keepers, we removed successfully the uterus. You can see the size of the uterus over the plate here. So this is during the removal of the, you can see until the animals achieves the desirable depth, and there must be synchronization with the machine and the inhalant anesthesia machine and the animal. We should watch for the stability of the anesthesia. Then we have to initiate the surgery. After the finishing of the surgery, then we have to bring the animal back. So, or we have to take out the anesthesia in a slow manner, in a smooth manner. She was still sleeping. She was in the sedation effect. So checking on our vitals for proper recovery. And this in this image you can see she was on her limbs like within like 20 to 30 minutes. She was on potent painkillers in order to make her comfortable. You see in this was very she came along with the humans in our zoo hospital. Like she was really well. She was well mannered and she was really into the humans. This image is a post operative day. She has healed really well, and she came back to her life, and she has gone back to her Gadag Zoo, and she is doing really. She is attracting the visitors there really well. This is another case of pyometra among lioness. See, I'm doing this vaginal examination, which confirmed the open sort of pyometra. So it's the blood draw. This you can see that we are inducing the intubation procedure. So as I told you, I always prefer the than visual method. I go for the tactile method of the intubation. So one thing the surgeons has to notice here is, say one person is holding the upper jaw and the lower jaw with the help of the gauze material, and one another person is holding the tongue, like which will make the way for me to access the trachea and the epiglottis. See, I am holding the trachea from outside, the tracheal apparatus, because the soft palate in the oropharynx is so elastic in among the big cats that if you try to physically, if you try to just push the trachea, so just push the endotracheal tube in the trachea, you will tend to move the entire tracheal apparatus inside to the thoracic cavities till the like it will go into the neck surface. So we have to hold this tracheal apparatus with the hand here from the external surface. Then we have to intubate. We have to secure the tracheal apparatus. Then go for the tactile sort of intubation. Then stabilize the animal with the inhaled anesthesia. Watch for the vitals for few minutes. So once you are confirmed with the proper sedation, proper anesthesia, then we can go ahead with the surgery. So you can see the pus-filled uterus has been removed. And this is during post-operative days, and she's an hybrid lioness from our zoo. So no, like previous lioness, you can't expect all the lioness to behave in the same way. So after surgery they will be under pain, they will be in a different circumstances, like we cage them, we will put them into the cage for few days for this is in order to, if there is any emergency conditions immediate post operative, we can access her if she is in the cage, if the lemurs are in the cage. It's a tiger, about 8 months old tiger, rescued from nearby forest, and he had an ulcerative wound, healing ulcerative wound over the left shoulder, which has been operated with in an emergency condition. So this sort of intervention will really result in the infectious outcome. So always we prefer, as we see in the previous cases, this sort of surgical aspects has to be attended in the proper sterilized the operation theaters. This is a healing stage of this one. You can see there is the healing going on with the slight scarring over that. Coming to leopards, she was a 5 years old leopard from our zoo, and she one fine morning she passed this dead fetus with us, malformed fetus, and we had a doubt that she might have the next fetus inside. So we sedated her, and before that vaginal examination, yes, she had an thing that has been removed, what you saw in the previous slide. Okay, we induced the anesthesia. We performed the ultrasound scanning. There we confirmed there was another cub inside her uterus. So then we induced her with inhaled anesthesia. Then we gone for the cesarean section, where we removed a single fetus. You can see the uterus has been exteriorized from the abdomen, and we're making the incision over the to in the side where there is no much blood supply. Okay. Because as much as small incision, so we'll try to take out the fetus. Okay, you can see that fetus was dead. So we confirmed that ultrasound scanning only, but we can see that there is the pet has the cub has been that has passed the meconium. What is that yellowish color seeing over the uterus is the meconium passed by the fetus. In a standardized way, the uterus has been reconstructed and sutured, and the animal okay during the post-operative days. So you can see that there is a naturally voided, deformed fetus on the left side, and again on the surgically removed fetus on the right side. During our post-operative days, so after surgery, like the wild bag, especially the big cats, they will be in a very agitated mental status. So we should watch from a distance, and we should make the condition, we should make the situation in a way that there must be no much human interaction or appearance over it. We'll cage them or confine them in a secure place where there is no much disturbance. Okay. This is another leopard. So where we suspected the metritis. So because she was ill and there was some signs of frequent urination, which confirmed that she had the urinary tract infection. So we did the blood work and all, and there was some issues over her. So we want to have an scan over her abdomen in order to check like the condition overall. In this video, one can really see that the animal has not been um, squeezed. She is just laying over there, and with a very calm approach. So we just see, can see that there is no restraining thing has been done over her. We just shaved and we go for the scanning. The scanning really went well, and we confirmed that there was now pus-filled uterus in another leopard with ulcerative wound in the second digit. So we just selected for the removal, the surgical removal, and again the removed the surgical site will be selected for the laser therapy, so which facilitates in the really good healing. Lions, coming to the lion again, the male lion Shaurya from our zoo, he had an maggot infested wound in a perineal region. So he has been sedated, like the mild sedation, not into the depth of anesthesia, surgical plane. So with the plane, with the superficial sedation, we with a limited access to the animal, we remove the maggots. As we see that the animal is pushed to the one window, and we remove the maggots, and so that therapy has been gone well. The cheetah, she had a lacerated skin over the anterior thigh, which has been sutured with a slight sedation. The lacerated thigh is over here. Okay. Jaguar with an pus nodule. So we feed the animal on the top in the cage, and again then we use and stick with a cotton bud. Then we'll apply the ointment over it. So this is a meerkat. She had an infight with a comet. Okay. So we have standardized the anesthesia here. Okay. So the anesthesia has been induced with the chamber induction. Like this will be put into a glass chamber, the enclosed chamber. Then the oxygen mixed anesthesia will be isoflurane will be sent to the chamber. This will take some time, but you should carefully watch for the depth of the anesthesia. So anesthesia was adequate. Then she was now taken out of the chamber. Then mask induction will be continued, and the surgical site will be prepared well. She had an partially lacerated the digit. Then after the evaluation, it was it was we suggested for the amputation of the digit. Okay, see in this case, this digit has been hanging over with the paw skin here. So we have to go for the reconstruction of this lacerated and ulcerative wound. So just been dissected. You can see in the right hand side, you can appreciate the reconstruction of the lacerated wound. In these X-ray projections, on the right hand side, you can see the caudal of the first phalanges, and the third and second, the third phalange has been removed. In this lateral position, also one can really appreciate the resected part. So coming to rusty spotted cat, the cause was not really known, and she had an avulsion fracture of the pin bone here, pin tuberosity, which has been reconstructed with the help of scale wire and the tension band wiring. ಮಾತಾಡ್ತಿರಲ್ವಾ ಇದೀಗ ಮೀಟ್ ಮಾಡಿದ್ದೀನಿ. ಈಗ ಆಕ್ಚುಲಿ ನಾನು ಹೇಳೇನು ಕೇಳಿದ್ದೀನಿ ಅಂತಂದ್ರೆ ಎರಡು ಟಾಪಿಕ್ ಮಿಕ್ಸ್ ಮಾಡಿ ಹೊಡಿತಿರೋದು ಹಂಗೆ ಆಗ್ತಿದೆ. ಇದನ್ನ ಕ್ವಶನ್ ಕೇಳಿದ್ರೆ ಹೌದಾ, ಇದನ್ನ ಆನ್ಸರ್ ಮಾಡಿ ಅದಕ್ಕೆ ನೆಕ್ಸ್ಟ್ ಹೋಗೋಣ. ಓಕೆ, ಈಗ ನಾನು ಸ್ಟಾಪ್ ಮಾಡಲ ಇಲ್ಲಿಗೆ. ಅಲ್ಲಲ್ಲ, ಎದ್ದು ಮಿಕ್ಸ್ ಮಾಡ್ಬಿಟ್ಟಿದ್ದೀನಿ. ಅವ್ರಿಗೆ ಹೇಳು ಆಯ್ತು ನಾನು ಹಿಂಗಾರು ಸರಿ. ಈಗ ಬೇಕಾದ್ರೆ 5 ನಿಮಿಷ ಕೊಟ್ಬಿಟ್ಟು ಯಾವ್ದಾರು ಆನ್ಸರ್ ಇದ್ರೆ ಹೇಳ್ಬಿಟ್ಟು ದೆನ್ ವಿಲ್ ಕಂಟಿನ್ಯೂ ವಿತ್ ದ ಟಾಪಿಕ್ ಅನ್ನು ಕಂಟಿನ್ಯೂ ಮಾಡಿ. ಹೀಗೆ ಮಾಡಲ. Next, we'll go into the canid family, the bear family, and the other canid family of our zoo. So, in this video, you can see an hyena which will choke and which will result in that the scissor kind of thing, which will choke like during the gulping of during the feeding of the meat. Okay, so I have been taking the topic of both the imaging laboratory, like the diagnostic imaging among the wild animals as well as the surgical aspects by showing the cases one after the other. So, yes, I am getting some questions from the audience. So, let me have the questions so they can answer and we can continue with the other cases.
Okay. So the first question is to you over the presentation, sir. What is the gaseous anesthesia protocol?
So, can I know the species like they are asking for?
They have not asked any particular
Okay,
species.
so if it's so, as I shown, we'll take the example of the big cats, the considering the lions or tigers. Okay, first when we have to evaluate the animal for the anesthesia, so like we have to go for the, we should know like what is the animal, why you have to subject it for the surgery. We saw the condition here is the pyometra which will have the compromised health. So in both the cases we add increased WBC count that has to be taken into the account. Okay, so after the blood work, imaging work has to be done. We should see how extent the problem is. Then considering the anesthesia, so in all the 3 cases, one is the hygroma case, the tiger, and 2 pyometric case, and even 1 lipoma case. In all these 3 cases, I have taken different combination of the anesthesia and also in a different dosage. So we have the facility to weigh the animal. So with accurate dosage can be titrated for these cases. If you take the hygroma case, I use xylazine and ketamine combination. So because that animal was comfortable and there was no infection condition or there was no compromised health issues. But in both the cases, like the lion with open pyometra and one case, lion Rakshita, which I showed the hybrid case, she had very elevated WBC count. In this case, so we used the diazepam and ketamine combination for the induction, and later on we'll go for the intubation and for maintenance by the isoflurane. So isoflurane, like, so once we intubated, we have to keep him for maximum at 5% induction. So we have to see like how the animal will react. We have to watch for the cardiac and respiratory signs during the anesthesia. So later on, we'll titrate for the required dosage. And during the extubation and the recovery of the animal, so we have to reduce the anesthetic dosage in the vaporizer. Then we have to push the oxygen for some time. Meantime, we have to see. Uh, um, Meantime, you have to see like how the animal is reacting for the recovery. Then extubate the animal once the animal gains the sense over the senses. Then sometimes in some cases I use the sedation for the for next few hours in order to relieve the pain, in order to make the animal comfortable. Can I have the next question?
Thank you, sir. There's another question for you. Have you ever come across the cases where there is severe blood loss and followed by hypovolumic shock? what will be the procedure to take the animal to the normal stage?
Okay, you can see there is that animal at hypovolemic shock, the tiger with excessive blood loss, which was in a rescue center. Yes, she had lost more than I can in a body weight approximately I can say she has lost more than 1.5 liters of blood, which comes almost like 30 to 35% of her entire blood supply. So in this condition, definitely she is under shock and she will really react very abnormally for the anesthetic induction. During that case, so we all know that the dissociative anesthesia works really well for the hypovolemic shock cases. So in that case, we used only the ketamine and we gave little amount of diazepam. We treated the little amount of diazepam. Then we continued the surgery. Entire surgery was only on the ketamine, and post-operatively we attended with the supportive therapy. We attended the cataleptic outcome of the case. We attended with the nutrition supplement, the feeding. Also in that case we observe the animal for 2 days. If she has shown any shock or hypovolemic shock signs, we have really considered the blood transfusion we already planned, but which shown really well good improvement after that. So there was no requirement of blood supply, so blood transfusion. So she recovered well. So there was no requirement for the blood transfusion. Yeah.
So next question is for laser therapy in case of primates, what is the duration and how much of joules was needed for it?
So there is no dose list for species. So the laser therapy it will hold good for even for the thick-skinned animals like rhinos, elephants, and even for the humans. The dosage is dependent on the skin surface, the coat color, the thickness of the skin, and also the problem, how depth the problem is. For example, in case of any deep-seated abscess, we will keep the higher joules. So in order for the laser rays to penetrate inside, considering the skin thickness also. So this is always decided based on the time and the watts of the power. So multiply this will result in joules, but it is always good to go according to the wattage and the time. In few conditions, we have to prolong the laser therapy with very low dosages, considering the deep-seated the problems. Very superficial problems can be treated with the very less, like you can consider the less timing. In wildlife we don't have the time, like we will not have the time to prolong for the prolonged laser therapy. So in this wildlife cases we keep the joules at the higher level, and we will finish the laser therapy within like as short as the short duration. Yeah.
Okay. So the next question is that what is the anesthetic protocol that was carried out in birds and primates?
The birds. So with our cases already shown, shall I take the case the white ibis? Okay, the white ibis, we induce the anesthesia with the diazepam, the sedation. Once the animal was was sedated, then we intubated with isoflurane induction. So we can even consider inducing the anesthesia altogether, like only by only by the isoflurane induction. Even that can be considered. That will work really well for the birds. And for the primates, depending on the health condition of the animal, I use the diazepam, midazolam, ketamine combination for the induction, later on by the mask induction, or for even by the endotracheal tube intubation. Thank you.
So in case of primates, they have been asked what is the anesthesia protocol carried out?
I just told them.
Okay. So the next question is how to assess the age in case of birds?
So that is very tricky question actually. So birds, when they're grown up, in especially the wild birds, even we have to get experience in that. So the age criteria by the shape and size, and even by someone say the scales on the limb also they consider. But even the beak wear and tears. So always it is they will have the it's an always approximation. It won't be accurate always. Like even I have to have the insights about this.
Next question is that what was the sedation that was gone for the tiger that got the radial artery injury directly anesthesia was given or sedation with anesthesia was done?
This thing just now. So we used the ketamine alone with a very little dosage of diazepam. For that now hypovolemic shock with the radial artery case, severe radial artery case, we use the diazepam and ketamine direct IV. So again, so we say 3 to 3 mg to 5 mg per kg if you use the ketamine alone in case of tigers. But when you are accessing the IV directly, you should consider the dosage. So the dosage will be very low and the induction will be very fast, and even the animal will wake up very fast. So the if you give the ketamine IV for the tiger at the dosage of 1 mg per kg. In that case, if we take an example, but the animal will sleep only for 5 to 10 minutes. And there will be a movement. Again, we have to top up the dosage by giving IM or IV.
Next question is that what was the drug that was used for darting in case of open pyometra, especially in that aged ones?
So in open parameterized ones, I always by blood work. It depends on the blood work, not exactly on the clinical science. Because all the cases in zoo conditions, we attend these cases as early as possible. There will be no compromised health condition. So if there is increased WBC count, then my preference that I might avoid the xylazine combination. I will go for the midazolam ketamine combination, or the diazepam and ketamine combination. Yeah.
Okay. Now we'll proceed with our presentation further. And then I think again the participants can post their questions in the chat reply and we'll reply them back.
Okay. So as I saw, there are many questions going on. And always I say there is no fixed anesthetic protocol for all the conditions we encounter among wild animals, even in any species in the matter. It always depends on the condition of the animal as well as the preference, the anesthetist preference. I might use the diazepam or ketamine combination was very compromised case, and even I use xylazine combination for that. So after giving the inductions, after giving the anesthesia, one must make sure the monitoring has to go really well, and you have to contact. We always have the reversal agent for few of the drugs you use, so we can genuinely you can in a balanced way you can use the reversal agent as well as the drugs in a sophisticated manner, like as we go like that. Okay, next we'll continue with our presentation. So next, as I told you, we'll go for hyena family, the bear family, as well as the canid families. In this slide, we can see hyena in a cage. We'll watch this video on Is audible now? Is audible? Okay. So previous case was not heard, no? Okay, okay. So okay, we'll continue. We'll continue and see. Okay, well, this is again a tricky episode for a vet in the zoo. See, one fine morning we saw this blood droppings in the holding room. Okay, you can see in the first picture. So blood is. You can see the nature of this blood. It is from. We will have the question where the blood has come from. Which animal? Because there was three animals, the mother and two cubs. So the keepers and the supervisors will have numerous questions like because the animals are not there in the room, they are in the den, artificial den created in the backyard. But by seeing this nature of these droplets, one can really say that this blood has come from the mouth because you can see the saliva in the blood mixed, and you can see the animal is tried to feed on the water, so even the water has been mixed with the blood. When we are examining the exhibit area with the security, we have about five to six people with um, um, the protective measures. So when we're examining the field condition, like then this the affected animal, the mother, she came out of the den. We focused on her. We got to know that the bleeding is from the oral cavity, and she looked very tired. And again, there was severe blood loss even in the exhibit area as well as in the holding room. And again, getting into the enclosure with the two cups inside, it will be a challenging situation, but we have taken the precautions and we are not on the ground, we are taking the precautions. And danger from our this one, she tends to go in and she tends to hide herself. Then it will be difficult for us to access her. So we were ready with the sedation. So the time when she sensed the danger or she has felt the panic, she was about to go into the den. You can see in this video that she is going to the den, but we managed darting her within no time. You can see. So she went into the den with off seated. We examined her. Okay, she was seated. Then we brought her into the. She only gone into the holding room. We locked into the holding room. So there, yesterday I had a question like how many darts I can consider by darting the animal. So there is no fixed number of darts. If you feel that animal is not sedated up to the desired level of anesthesia, you can always consider giving the second dose of anesthesia. This all this thing will be decided over what anesthesia combination has been used previously, what is the current status of the animal, what is the response for the induction. Considering all this, the vet can decide like whether we have to go for the anesthesia, the second dose of anesthesia, or what anesthesia should be given in the second time. Is everything depends, there is an interlink between all these aspects. Then we shifted her into the OT, and when we examined our whole cavity, we got to know there is loss of entire like the 50% of the tongue. So how this has happened, it is really unknown condition, like she had the bleeding all over, whether she had a fight with other med, because she had the little cubs, like only 3 months old cubs, they won't come into fight with the mother, but it's really the cause is really unknown. Might be she had a fight with the neighboring thing neighbor, the hyena housed, but it is inevitable that there is a mesh between them. So still we have the confusion over this. So we intubated the animal, then we reconstructed the tongue, and by removing the devitalized part. So in this picture, you can see always for any wild animal anesthesia, wild animal surgery, they should have a specialized team. In this picture, you can see we have the intern here, and myself is for the surgical aspect, and we have some. This keeper is from. I'll show on the laser point, and this keeper is from the hyena enclosure, and this person is from the that section supervisor. He is a hospital staff member. He is really well talented in handling most of the animals during surgery, and they know well that how to hold the oral cavity while I intubate. So this training has been given to few of our hospital staff. So they have the physical strength, or we can say like they are physically very active in handling all these sturdy and dangerous animals. So this is during post-operative days, like immediate post-operative, and our keeper has tried giving them tiny muscle chunks. So one should really understand here that she doesn't have the tongue now. So it will be very challenging for her. It will be impossible, I can say, but to lick the water and as well as to take the meat chunks, there is some minced meat. So I asked him, so you think in this way that she doesn't have the tongue, she can only gulp the meat now. So we have given the meat pieces in the regular manner, and immediately next day she has taken the meat pieces like in a normal amount, and again considering the water, so she can't lap, right? She can't lap the water. So we have to give the water in a depth vessel. We have to create the new, we have to design the new vessel for her. We have to keep the depth so she can put her entire oral cavity inside and she can drink the water. But she has to learn how to feed and drink the water with this no with the with is not supported by the tongue. And another young hyena. So when we examined, I think that you can see the bone, the phalanges in this maggot infested wound. So these animals are too subjected for the removal of the digit amputation. You can see how to assess the trachea, the tracheal intubation. So say that endotracheal tube is in the uh, proper placement. You can see the vapors in the transparent tubing in the endotracheal tube. So you have to confirm, and even you can confirm with anesthesia machine. There will be respiration thing. I can even see the valves when there is inspiration, the valves will close. When there is expiration, the valve will open. These things are well facilitated in the anesthesia machine. So this is a surgical site. So where we have cleaned the area with disinfected the area, and we applied the anesthetic lotion. We scrubbed the area, and we have gone for the standardized way for the removal. So the removal or the fixation will be same like any other animals, but the suture will be has to be considered in a specialized way. But there must be security, like we must close the the wound in a secured manner. We can use the multiple layers, and you can use the suture material in an desirable selection. You can see after the post surgery. So as I saw, many our profession will have induce the animal, connect the surgery very fast, and give the reversal agent. Now, like according to me, I can say give the anesthesia, take him into the OT, induce the anesthesia in inhalant anesthesia, and analyze the depth of anesthesia. You'll watch for the animal for few time. So then you will come to know whether the animal has been well settled with the anesthesia, with the desirable depth of anesthesia. Then carry out with the surgery. Once the surgery is done, then come back to the anesthesia and monitor the animal, slowly reduce the anesthesia and give only the oxygen for few time. Then extubate the animal. Then give after immediately after the extubation, you have to give the oxygen support by mask method. And later on, we can then when the animal starts to move, or we can even, if it is very dangerous animal, we can shift the animal into the cage in a secured manner. Then we can give the reversal agent and make sure that always the analgesic and immediate recovery will have the adverse effect. So analgesia and the reversal agent, anesthesia has to be given, analgesia has to be given. The reversal agent is a choice of the surgeon who is carried out the surgery. So this is software thing, and this is, you all know, this Elizabeth collar applied over this, and few of men might be surprised, like why this, can this wild animal tolerate this the Elizabeth collar? Yes, of course they do. They do tolerate this. They can negotiate the feeding and their daily routine with this Elizabeth collar on. You can see I'm extubating the tubing. This is recovery. The few days, like one couple of days, animal might be uneasy in feeding the food or water, and the recovery. You can see after 15 days of duration, still the Elizabeth collar is on. Animal tried to get rid of it and even tried to bite. You can see over here and all, like the inner surface, but that was unsuccessful. Then meantime, the wound healed really well. So that's a time where we have to remove the suture material. You can see in this video the sutures are intact, and we confirm the proper healing with no second intention, with no complications. we I mean this particular individual has allowed us to remove the sutures with no anesthetic or sedative protocol. Okay, even as the animal was young, was to humans, we removed the collar, but one must be very secured. It will be very dangerous, but one must be very secure in handling those animals. So we removed the collar on the day of removal of the suture. So overall thing went really well. So this case, she had an continuous cough and she was not doing well. The off-feed condition was so long time. So we have selected this individual. She is about 8 years old female, Aina. We brought her into the OT, means our hospital facility. Again, there is a reshot of the PowerPoint presentation. Just a while. Can you see? Okay. So as I told you, she had some medical issues. So for the complete medical examination, so we sedated her and we examined for the depth of anesthesia as a routine. Like then we brought her into the OT. Then we gone for the X-rays, entire body X-ray and ECG and blood work. So you can see in this picture we are going for the lateral projection of the thoracic cavity and the DV, like the ventrodorsal projection of the thorax, and again the lateral projection of abdomen, and again the DV, like the ventrodorsal projection of the abdomen. So you can see we'll most of the time in our zoo we'll have the internists from many colleges, and they will have the when they when we are doing this, so they're really appreciating this. It's a very good chance for them to have a look on these medical aspects among the wild animals. Can see here no induction has been given, but you have taken them to the OT for the evaluation of the cardiac condition for certain period of time. You can see in this picture, like we have taken the blood samples. This is for entire martial health checkup. Blood samples and ECG work is going on. So we saw our entire conditions and the examinations. We left her back. Now she has a few cardiac issues which has been attended later. Okay. And you can see in this case again, this individual had the tail docking thing with the infight, and again we employed the Elizabeth collar to avoid the arterial mutilation, and that has resulted in good healing with the minor surgical intervention. Coming to the jackal, is a rescued jackal. So they had the vertebral column fracture, but you can see there is overriding fracture of the L1 vertebrae, which was really not a good candidate for the surgery. See the jackal here, this individual had the distal 1/3 fracture of transverse fracture of radius ulna, which has been fixed by external skeletal fixation. And coming to external skeletal fixation, so there have been very debate on whether this external skeletal fixation works well on the wild animals that took canids and fillets. Yes, with my experience, I can say this is the one which will work better than any other fixations. But this might demand some the technical approach. But this will really work well. We can allow the animal to walk immediate next day, and even animal will not have any discomfort or the annoying feeling of any bandages applied over the limb. You can see the position done immediately after surgery, that you can see like there is near normal position of the bone fragments. In this video, slow motion video actually, but we'll see how it will be played. Animal can really walk immediate next day with the apparatus on, and it can usually the any fractured bone fixation principle says that we have to immobilize the distal and the proximal joints. But in case of external skeletal fixation, that is not necessary. So animal can negotiate the walking with no lameness. You can see here in the slow motion video, animal is comfortably bearing the weight on the affected limb, the left front limb, which is not possible by any other sort of external splint or plating or any sort of pinning technology. This is a time where we remove the external skeletal fixation. We can see there is good amount of callus formation and even the bone formation. There is very good healing pattern. And this is where we left the animal into the back to the enclosure after complete healing. So during this healing time, the animal will be in the post-operative care in the inpatient ward of our zoo hospital. Is it the video is playing well or it's not like this? No, it's playing well there. Okay, I can see the animal has gone back to his family. Okay, same similar sort of fracture in another dole. So same sort of approach. This is my apparatus, like the you can say my instrumentation for the external fixation. Fix if there is compound fracture, open the fracture and fix and make sure the position is well. Then you can see there is transfer fracture of the mid diaphysis of the radius ulna, which is fixed by the external skeletal fixation. So these individuals had corpus vulgus as a congenital deformity, but he had a fracture in the radius ulna, which was fixed successfully. And coming to the dolls again, so she is a very good mother of her cubs, the puppies. So since today she is not feeding on the diet, feeding on the meat. So there was a big question mark. She is all finding well. She is active and all, but she is not able to feed on the meat. Once we take her into our thing, when we gave the anesthesia, when we examined the oral cavity, we got to know that her tongue has been lacerated. We have seen this case in Heine case previously. So it was um, um, in a similar, like, standardized way. How to evaluate this animal post-operatively? Again, there's a big question mark. We have to wait for a long time for the animal to yawn. This is the method I followed. So when the animal is yawning, this has taken very long time for our photographs. The tongue has healed really well within like 15 days. Coming to the black bears, this individual, he is 20 years old now, and he had the dental fistula. So affected teeth was the upper left canine. So we daughter the animal. So animal came down and surgical intervention has been carried out. We can see in order to see the root of the dental fistula, we have to go for the skull X-rays. We can use the grid also here. So the X-rays will really give an idea about like where the communication is the dental fistula. Then we can point out which the teeth has been involved in this problem. So based on the X-rays only, we got to know the upper left canine is involved in the problem. Then we gone for the extraction of that teeth. So we can go for like this, only the upper jaw projections. You can see the root here. One can really appreciate the root of the dental fistula here. Then giving the reversal agent and observing for the recovery. Once the animal recovered, good. And coming to another sloth bear case, her name is Tunga. She has been recruited from Tumkur district, and she developed a lump in her right breast region. Okay, then we first we connected the blood work by giving anesthesia. We figured out how big the tumor is, and then one day, like within like next 2 days, we planned for the surgery. We prepared her by fasting her. We gave the session. This is the we can see that I'm holding the mass in my both the limbs. So then going for the intubation, the anesthesia used here is xylazine and ketamine. So as I told you, tactile method, like I will go inside the oral cavity, outside I will hold the tracheal apparatus, then I will feel the epiglottis, I'll depress the epiglottis with my finger, then I will introduce the tracheal tube into the endotracheal tube into the trachea. You can see here is a post-operative picture. So whenever I carry out the anesthesia with intubation anesthesia, so after some time, whatever the pre-anesthetic given or the sedation given, that will wear off, the effect will come down. The animal will be only on the inhalant anesthesia influence. So one should have the um, security, or we can say like the animal more surgical site will be maintained clearly. But when we do this procedure, I always prefer to have a net in place. You can see our team, our doctors and our hospital team. So this is a resected part of mammary gland. It was tumorous in condition. You can see that. This is the way we extubate. So once we confirm that she is showing the, first we will cut off the isoflurane induction, then the oxygen will be going on for few minutes. That based on our cardiac and respiratory responses, then we'll decide over removing this. Then that will be replaced by, and we have to, now the airway can block by the tongue itself. We have to make the tongue, we have to place the tongue away from the oral cavity. Then we have to supply the oxygen by mask induction. So after the thing, and the mammary gland has been subjected for the histopathological examinations. This is during the immediate recovery time in our holding room. Okay. Come to the full. Again, we'll have this time. See. Again, for this is for the castration in order to control the breeding. We'll go fast. We have little time next. We'll see, and we're going for the spaying. This is a wolf with laceration of the elbow region. Okay. So with this, we'll go for next presentation. Almost how many left? 5 minutes, 15 minutes. Okay. Can you see? Okay. So now we'll see a few slides on the door. Okay. ಅಲ್ಲಲ್ಲ ಇದು okay. So there is to give share. Okay. Now. Okay. So we'll go fast about this. Gore with an lacerated the greater curvature of the knee joint. Then it has been successfully like reconstructed. Then he had an mutilation. Then we reconstructed again. We applied the fiber cast where the animal can't flex the knee joint again. So we applied this fiber cast for about 1 month time. Then later we removed it. So while removal, like on the removal day, like we saw the wound gaping has been filling with the granulation material. And again, the fiber cast has been applied for few more days. So second time we let it for almost like 60 days. We are not removed the cast for 60 days. Then there was a good healing. Like you can see that granulation popping out of the skin, which is not allowing the skin to fuse up. So then again, that portion has been removed, and animal has taken about 3 months for the complete healing of this. Same animal next year on the right limb, you can see the big laceration, huge laceration. So animal has been given with etorphine and xylazine combination of anesthesia. So one should make sure the airway is not blocked by the salivation. Go for the surgical reconstruction as standardized way. In this picture, you can see that everyone has some other part in the um, surgical intervention. Like a few people are holding the animal, and here I have been assisted by a few people for the surgical intervention and even the fluids. And see, you can we have placed the gunny bag over the body, and continuously the water has been poured out that, because as I told you in my previous class, the etorphine induces the hyperthermia condition, and every 5 minutes we have to monitor the temperature. And if it is going like more, that has to be avoided before it goes up. So you can see animal is up on a limb. After the surgery went for 2.5 hours. The etorphine we used the etorphine for 2 more times for the top up, and the surgical intervention went almost like 2.5 hours. The animal is up on the limb. You can see Neil guy with the fractured tibia, which is observed over the video. Again, external skeletal fixation has been um, followed to fix this fracture fragment. Okay, again, other lacerations in other herbivores and tail docking, with compromised vaginal lips. Okay, this will go fast for this. And this is an ultrasound scanning over the rhinoceros in a protected contact method. See this. Now we'll go into the mega herbivores. So we'll go fast. Like this is the rhinoceros, the African rhinoceros, and she came to our zoo almost like 1 year back, and immediately after like 1 month of time, uh, this female white rhinoceros had an colic episode. You can see that she had a colic episode. She was sitting down and getting up. She was literally on pain. Then considered giving her the analgesics, painkillers, the analgesics, and even we considered giving her the gastric lavage, like the rectal evacuation and the infusion of the fluids. In this video, you can clearly see it is very challenging situation where you have to take the confidence of the animal and the keeper main especially. You can see that keeper is rubbing the inner thigh and she is responding really well for it. And with the simultaneously like I'm taking like I'm introducing my hand into the rectum, so in a secured way. So almost there must be a way to escape here. And yes, of course there will be risk in this, but considering the animal, so in a secured way we can perform this. She had an hard fecal matter which has been removed, and this is where we are infusing the fluids, about 20 liters of the fluid with a laxative agents we have infused into the rectum. Again, you can see like as depth I go, there was hard feces. So this is like she was getting into our Indian feed material. Like she came all the way from the Singapore. The feed nature will vary, but so this is the reason where she while she was adjusting for our feeding, she had few episodes of colic. It's a fecal matter report. Again, during second episode, again the same condition has been followed. And again, you can see that we have two white rhinoceros. Their horns are really sharp. So even during the friendly fight, they used to end up with the lacerations, as you see on the forehead of this male rhinoceros. So we gave the sedation by using etorphine and midazolam combination. We managed trimming the the horn. And she is Vita, she is the female rhinoceros. See, all the individuals will be not same. See, first the male, we connected this on trimming over the male with the sedation, and second the female rhinoceros, she was quite cooperative. We had the plan of removing like the trimming the horn without sedation. We'll see how we have done this. So you can see there is an round pipe barricade where we are offering her the feed, the fruits, and she will put her in order to attempt for the feeding, she will put her horn outside this window. So that's how we can access her thing. You can see now clearly that they are offering the fruits. She will do that, and with multiple attempts, we can perform this horn trimming. So we can avoid the sedation, but it won't be possible in all individuals. So another case in Indian black rhinoceros where you can see there is a very deep, as an Indian rhinoceros. So there is a very deep laceration in the tail. So if you leave it so that definitely that will go deep and there will be compromised blood circulation to the caudal aspect of the tail, and that might result in the falling off of the tail. So we have taken the attempt to sedate the animal. In this video you can see the injection site area. Then we have darted with the blowpipe. Like 6 minutes of time, she started showing the induction signs, and and we took her into the surgical intervention. She was settled on the the soft paddings. Then standardized way we fixed the surgical site by debriding the devitalized tissue. And I employed the Elizabeth collar to this because in order to avoid the urine and the fecal matter to fall over the surgical site, the think the Elizabeth collar has been used for about 15 days. This picture shows the giving of the reversal agent, and she was up on like within 3 to 4 minutes of time. And during post-operative days, so the laser therapy has been employed, the wound washing was employed. You can see this is the first day, and again, this is like after like 1.5 month of time. Another Indian rhinoceros had an episode of very painful thigh. She was not able to move around. In the right hand side, you can see the thermographic imaging of this animal, where you can see there is enormous hot surface here that can't be felt by our palpation, which can be seen only by the thermographic imaging. You can see there is very hot surface on the right lateral aspect of the thigh. You can see here on the physically we can't see anything, there is only the swelling, but appreciation of the problem is not so evident by the naked eye. By thermographic imaging we can really see like how the painful the site is. Then after like few days it started showing them um, okay, you can see. So with this, we'll go for next last one, the surgical. Okay, this is about the reptiles. We'll finish it up in next 10 minutes. So this is anaconda. Okay, so this animal is about 8 years old, and he had an lump growing in the like last caudal aspect of his body. So just about a feet, 12 inches above the rectum. So one fine day we have seen the enormous blood discharge. You can see that there is a blood oozed out of the site. It has fallen on the ground. Then we considered for the surgical intervention. So this is how we gave the anesthesia. So it was sedated with the help of zolazepam and tiletamine combination, followed by the isoflurane induction, mask induction. So animal was sedated. Standardized surgical way, the mass has been resected, and this is the post-operative medications. And here you can see how the animal is reacting. Like this is the recovery period. See, than surgery the recovery time has taken more than an hour. We have to calmly patiently wait for the complete recovery of the animal, then we can shift the animal to the enclosure. You can see that we're going to test like how well she is on consciousness. Okay, okay, this is a breathing pattern in this video. Due to the limitation in the timing, we'll go for the next cases. This is the recovery time. Like she has recovered well after the anesthesia. She almost took about 6 hours to the complete recovery. This is a cloacal prolapse in albino cobra, and again crocodiles with tumors resection, and crocodiles, the plating of the ulna bone in a crocodile, in a caiman crocodile, you can see there's a fractured ulna and the plating of the ulna bone. And crocodile, the caiman crocodile with the injured the cornea, they will have the extra two layers such as spectacle space and the spectacle. It has been injured. They can see and localized hematoma over the injured site here, which has been addressed surgically, and the toxography has been followed up. Washing and local introduction of the injection of the lignocaine and addressing the problem and raising it back. You can see the recovery, that before and after picture of this. Last one. So we'll see last one presentation about the blood collection and CT and MRI on wild animals, which I can say it is a new thing for the wild animal in Indian conditions. You can see this meerkat has been suggested for the CT scanning. She had the thoracic involvement, some pneumonia sort of problem. So we wanted to have a look on the 3D. Okay. Okay. So you can see here, this is a CT scanning room where we are subjecting one meerkat for the CT scanning. The CT scanning, the meerkat has to be sedated and it has to be placed in a cardboard to in order to make the animal not to move. Like always, the sedation will be mild because animal is already compromised. So it has been fixed over the cardboard with the help of adhesive tapes, and the CT has been went really well. You can see here CT scanning of the meerkat. The CT scanning is going on. CT scanning is nothing but the container like the 3D X-ray, like is like you can see in all the sections like coronal, sagittal, and axial planes. Next thing is this tiger had an repeated seizures as we discussed about this case previously, and once we shifted to the other enclosure, she had an severe seizures are more than like 15 minutes. Then we addressed her in like supportive therapy has been given, but she failed waking up. She has the senses, but she was almost like she's not on the conscious like that. So we decided to take her for the MRI scanning in the local facility. We fixed her in the coil like this. Okay, we want to have an MRI of her skull and the brain. And see here. Then the coil has been fixed and she has been presented for the MRI scanning. And later on with the MRI scanning, we got to know she had a cerebral edema because of long-term seizures. So later on she succumbed. So the problem has been discovered, and this sort of influence given by our authority to take the animals out of the zoo enclosure, zoo premises, and going for the CT and MRI scannings, it's really an well appreciable or thank giving thing from my side to the zoo authority of Mysore Zoo, and yeah. And at last, say like collection of the blood from few the exotic species like crocodile. You can see now in this video, I'm accessing the lateral vein. You can see I'm accessing the lateral vein, but you might take 1 or 2 attempts. But so if you concentrate on the anatomical features, definitely one can really draw the blood out of them. So you can see the blood has been drawn from the uh, thing. And this is monitor lizard. You can see the blood collection technique, and it is from the ventral vein. You can see animal has been handled by a well-trained handler. You can see the blood has. This is for the entire evaluation of the health status of the animal. So with this presentations, I hope I covered the surgical interventions and the necessary diagnostic imaging made for the animals for the confirmation of the problem and the proper addressing the problem in a proper way. So with this, I can say, let me have the questions and later we'll do that. Yes, you can. Is it okay? Okay. Fine, fine now.
Okay, thank you, sir. We have many questions that has been posted by the audiences, by the viewers. So the first question regarding the previous presentation is that is there a need to check over the WBC count while anesthesia?
Not only WBC count, here I considered in case of pyometra in the previous presentation what I told you, but not only the WBC, there are many other criteria to consider to decide over the to in order to interpret like what balance anesthesia has to be given for the animal. It's not only WBC. WBC is one of the primary criteria to consider. Do yes, sir. Like that.
So next question is how to decide whether to use just ketamine or in combination with diazepam or others.
So as you all know, the nature of the drug ketamine. Okay, ketamine is the dissociative anesthesia. So where it is used in more often in very compromised cases. Yes, we do agree. But ketamine, when you inject only the ketamine, the animal has to spend a lot of energy. That there will be continuous muscle movements, muscle flexures, and to in order to counteract this part, we can use a mild sedative like using at the diazepam or the midazolam in the very low dosage for the compromised cases.
So the next question is what is the actual dosage of etorphin HCl or Captivon in case of gore to immobilize it?
So the approximation is about 10 mg per about 800 kgs, like 1 mg per ton, like the 1 mg per 100 kgs, like that we can take. So we have used over 700 800 kgs of gall in our zoo with 78 mg of ketamine in combination with about 30 mg of xylazine.
So the next is please elaborate on anesthesia protocol for reptiles.
Reptiles, okay. So in reptiles, can we take crocodile or snake? Snake, we can take snake. We recently saw this anaconda procedure. So anaconda is a green anaconda what we have, and we add a granulating nodule in the caudal aspect of the body. So in this anaconda, I used the combination of zolazepam and tilatamine combination, followed by the isoflurane mask induction. And even you can consider giving the ketamine too. So vets, like as I told you, it depends on the availability of the drugs and also so the expertise of the anesthetist. Or see, you can use if you give me a new drug today, if I'm not used this zolazepam earlier, zolazepam and tilatamine combination, that is Zolital drug. If you give me on the first day, I prefer using my old protocol than going for the new one, even it has the good advantages. So I go for the previous one. One should gain the confidence over the new anesthetic protocol, which we incorporate in our practice slowly and with the sharing the experiences of and going for the um, with the experienced people we can discuss and we can go for the adoption of the new protocol steps. Yeah.
So the next question is that have you come across any pseudo pregnancy cases and will those animals be capable of giving birth to healthy young ones again?
Cases, I'm not confirmedly diagnosed in our zoo, but animals can do come for this. We have seen a case of follicular cyst in a leopard, which is again the rare condition. So she was showing the heat symptoms continuously, like she used to rub herself in a way that she used to end up with the abrasions. She used to rub herself to the face always. When we go to the enclosure, she will raise her tail, she will elevate her pelvis, and for the it is like the mating command. Okay, so then we scanned her. We got to know that she had the very big follicular cyst, which has been resected by conducting the orophyrectomy. She was resolved. But coming to the pseudo pregnancy, the confirmation is not on because there is spontaneous resolution of it.
So there's a question posted by one of the vet that she has been facing rejection in case of pangolin, the feed rejection. How to overcome this, and it has been rescued 2 days back.
So again, yes, then this can't be answered at one shot because you have to know like where the pangolin has came from and what is the condition of the animal now. Feed rejection might be because of anything, stress, the medical issue. You have to evaluate the clinical the presentation of the animal. See, pangolins in case they won't exhibit, the problems are not much appreciable. So you may have to go for the evaluation by simple methods like blood examination, also by going for the diagnostic imaging. But by doing all this, the animal will tend to undergo the stress. Stress is the main factor where it might be rejecting the feed, but things has to be evaluated. I can confirmly say this, but the stress factor, the housing factor, the how many people have handled this before, and what is the current medical status, so it all depends on that. And this can be overcome by addressing the problem. By knowing the problem, we can address the problem. And also the housing strategies has to be followed, and we have to seek the experience, or the experienced person who are already have the experience with these pangolins. We can adopt that steps, and we can make sure that the things have gone well from our side, and rest is left to the animal side. Yeah.
So here is a question to our executive director, sir, that whether any specialized training can be given to is there any training program for other state vet students, and is there any provision to get trained on wildlife for government veterinary officers? So I would be answering on behalf of sir, so that where sir has replied for this, that already final year BVSC students from Karnataka and Pondicherry are doing their internship with Mysuru Zoo. For other state students and serving officers, it can be organized on payment of nominal fee. The fee depends upon the cost involved in organizing such trainings. We are self-sustaining institute. Thank you, sir. Now there's an again next question to you, sir. Please talk a bit about the blood transfusion in animals regarding their compatibility and possibilities of inter and intra species transfusion.
So intra and interspecies transfusion is again a big chapter to discuss. So I will directly go for so how how a vet can decide over the transfusion. So we'll take our own example from our case, like hypoponic shock, or the animal which had the severe bleeding, as we saw in case of the hyena and also in a tiger. So there we have to evaluate the animal. So we have to see, so what is the loss of the blood, and we have to clinically evaluate how the animal is reacting for the blood loss. So if it is so, if the blood transfusion is very evident, we have to go for the blood transfusion. Means we can collect the blood from the recipient and the donor. We can go for the cross matching. Cross matching is really essential in whatever the spaces. That is really essential before the transfusion decision. And again, when we consider transfusion in the prime animals or very valuable animals like the tigers, again it depends on the authority that we are subjecting another animal to save the sick animal. Okay, anyway the sick animal is so it's compromised. In order to save that, so there'll be a lot of questions and lot of justifications will be given to sedate another animal and draw the blood from it. And it is not a common procedure, but it is not impossible. In future days, I feel this will also become a common procedure among the wild animals. Next question.
So, atropine and xylazine dose in gauze for surgical plan of anesthesia. How much dose is being offered for the gore in free ranging during human gore interactions?
So with my experience, I can say like um, whatever the prescribed or the standardized literature says, the dosages they vary between the zoo animals and also the free ranging animals. So once in my very initial gore rescue and free range, so I just followed the way I gave the anesthetic dosage, like how I follow the atropine dosage in our captive animals. Captive animals will remain very calm. They are used to humans. Even human can go and touch them. So with a very calm and planned environment, we give the anesthesia with no disturbances. The animal will go into the surgical plane. But in case of the free range, the topography or the geography will be entirely different. Animal will be agitated, and most of the animals what I encountered in my professional career in free ranging, they will all have one or the other medical issues. So considering that, if you considering the medical issues of the animal, if you consider compromising the dosages, it will be again animal might not sleep completely, and if you give more like animal if you give the adequate amount of atropine, if the animal has any underlying cause, that might react in a very different way. And recently, it happened with one gore in our Karnataka state, that so animal had a labored bleeding, but it was inevitable that animal was about 15 kilometers away from the forest, and there was a threat from the threat for his life. Like overall, it is in the field. There is no forest around. Because in order to rescue the animal, we have to take the risk of giving the anesthesia. And when you gave the anesthesia within 40 to 50 minutes of time with adequate anesthesia, like 8 mg to 9 mg of or say with no xylazine was given because of, like, when I examined the animal, I felt xylazine might be not good for this case. So we employed only the etofin, but the animal succumbed after like 40 to 50 minutes. When we connected the postmortem, only we got to know that there was enormous pleuritis, the pus-filled thorax. So this underlying cause, which is very major cause, was not evidenced before the anesthesia. So this is the thing why this free-ranging anesthesia is very challenging in case of wild animals.
What is the preferred anesthesia for herbivores, like in case of antelopes and deers and even goats?
And first of all, there is a lot of difference among these two species. In deers, you can go, they can give like 1 to 2 mg of 1 mg of xylazine, 1 to 2 mg, you can consider 2 mg also, 2 mg of ketamine, and 3 mg of ketamine. This will, we can easily sedate a normal healthy animal for more than 40-50 minutes, and you can consider giving the reversal for the fast recovery. But when you come to the antelopes, they are very sensitive for alpha 2 agonists. So we have to the dosage required is really minimal. That is like 0.01 mg per kg body weight. So the animal is very tiny. That's overall for a 10 kg body weight you might require about 3 to 4 mg. As I remember, because like always I refer this. So I remember the overall the dosage required. The xylazine dosage for the antelopes are really less compared to this.
What is the anesthesia used for herbivores ranging in weight group up to 30, 60, 100, 180, and 300 kgs?
So we can't decide the anesthetic dosage only on the body weight. So one must have the idea about when you, most of the time we may not be able to weigh the herbivores even in the zoo conditions. Okay, so if you consider that is 30 kg, 60 kg, if it is a deer, okay, if you consider the per kg body weight is 1 mg xylazine, you can give 30 mg for 30 kg body weight and 60 mg for 60 kg body weight. And always, well, the anesthetic dosage is not only, it is not alone dependent on the body weight, it depends on the age, sex, and also the medical condition, the stress factor. So according to that, see, weight is also one of the important criteria to be considered in anesthesia, but you should also consider the other factors of medical involvement too. Next question.
What was the frequency of USG in case of rhinoceros?
So yeah, this is a frequent question I asked from my my internists or even other doctors. So they always feel that uh, the the frequency has to be so low, like in order to penetrate the thick skin. So ultrasound doesn't have any such hindrance with the thick skin or the light skin. Like there is nothing like that. The density doesn't matter. You can really appreciate. I've seen, like in ultrasound scanning, I've seen the internal organs like how I seen in a dog. See, there is no such disturbance or resistance. Um, in case of ultrasound scanning of any species, but you should consider, like, if you want to go deep enough, your frequency must be low. If you want to see the superficial in a very clarity way, so the frequency has to be less.
What human antidote you use for etofin?
I have to say that because no, I don't know now. Yes, there is many other. The most of the time, the literature says it's only the supportive therapy. So once the accidental injection of the etofin, so one must maintain the patency of the respiration. The respiration, the ventilation has to be maintained till this wear off. So other supportive therapy as can be considered. There is no such, because you can't use diphenhydramine as we use in other wild animals, but naloxone is the one drug used as an antidote for the morphine anesthesia in humans. But when it comes to etofin, which is about 6 to 10,000 times the potent of morphine, so dosage and the drug has to be evaluated, and that can be considered later. Yeah.
Unless we try new safe advanced anesthesia like Zolitil, why wait till someone else does it when there is a lot of scientific literature on it?
Yes, of course. See, whatever I guess there is Zolital. So only I started using the Zolital in among animals. As you know, till date, like the Zolital is not available in India. Now it is available. Now in few days it is now it is coming into our hands. Okay, so with lot of literatures, after going through a lot of this is what I mean. go through the literatures, you know the experience of the other doctors who have employed this drug on various species and know their responses. There are a lot of records which says how the cardiac system responded for this anesthesia, respiratory system, and post effects, post anesthetic effects. Considering all this, know the experiences of the other doctors, then we can start adopting ourselves. And in the first or in the first very usage of it, and, and second time or third time, then we will have the personal experience with the animal we're dealing with this combination of anesthesia. So then we can adapt well with the experience, with this experience. Yeah.
So here we have our last question. How can we diagnose pregnancy in elephants?
Pregnancy in elephants, we consider doing the ultrasound scanning. So for that, only in the advanced pregnancy we can find the ribs of the calf in the abdomen when it comes to the superficial part. Like it has to be close enough to the abdominal surface, because the ultrasound scanning can go up to about 18 to 20 centimeter depth. That's all. We can't go deep into it. So the most accurate diagnosis will be the projection estimation from fecal matter or from the blood examination. You can consider the pregnancy hormone, the progesterone. So by seeing that is one, not only by one examination, we got to collect the samples at different levels, different time duration, and we can see the continuous elevation of the progesterone that confirms the pregnancy. There is a protocol for this. Yeah.
Well, thank you so much, sir, for such a wonderful presentation and insightful presentation. Now we have our next session, which is going to
Okay, before I conclude, I want to thank the organizing committee, and also I want to thank our executive director, Ajit Kulkarni sir, and also our member secretary, Ravi sir, and also my teammate. And we have gone through, we have seen many surgical conditions now. So this was really not possible unless until I have the support from my team. So namely Dr. Ramesh, my colleague, assistant director of Mysore Zoo, and Dr. Manjunath, and also our hospital team, namely Kumar, Shivananju, Madhav Swami, Bhaskar, Somu, and all the keepers of our zoo. So they have been really wonderful in their job. Without them, these things are not possible. Even they may not be technical, but so in order to execute my technical procedures, I need the help of them. I need their expertise too. And I thank each and every personnel who are involved in this development of this whole entire session, and also the that a wonderful care taken over the animals. Thank you very much.
Thank you, sir. So next our session would begin at 2 o'clock, and that would be by Dr. Sujay, Veterinary Officer, Tiger and Lion Safari, Tavrekopa, Shimoga. And he would be delivering his presentation on role of zoo veterinarian in rescue and rehabilitation of wild animals. So, and one more thing is that before we start with the next session, I request all the viewers to log into the to visit the same link of YouTube for the next sessions. Till then, you can also be viewing our small documentation on Zoo Mysore. So if any other questions you have, you can please post it in the live chat. Thank you.
కలిసి యూట్యూబ్ కలవడం కలిసి రాదతాను యూట్యూబ్ నేను కలిసి
Just also.
It's early morning at the Mysuru Zoo and the beginning of a new day. Our zoo is one of the oldest in India and was established in 1892 by the 23rd Maharaja of Mysore, Sri Chama Rajendra Wadiyar. During his time, it occupied just 10 acres of land. But over the years, it has expanded tenfold and is now home to over 150 species of animals from India and around the world, including wallabies and cassowaries from Australia, hyenas, rhinos, wild dogs and elephants from Asia, giraffes, zebras, cheetahs and hippos from Africa, and tapirs, jaguars and spectacular birds from South America. This film provides a glimpse of typical events during a day at our zoo. We'll introduce you to some unforgettable characters and even give you a sneak peek behind the scenes. Join us on this expedition and discover why we have been consistently rated as one of the best zoos in Asia. Our zoo is not just renowned for its diverse animal collection, but also for its stately gardens. Designed almost a century ago by the eminent German botanist and garden designer G.H. Krumbagel, these expansive grounds are meticulously maintained to this day. Elegant heritage structures add charm to the gardens, like this bandstand, which was once used to stage music performances. Another historical landmark is the Thandi Sadak or Cool Road, which kept the king shaded as he rode in and out of his nearby summer palace. Today, you can experience both the old world charm of the Maharajas and the excitement of a modern zoo. Set in the heart of Mysuru, our zoo is one of the city's main attractions and is visited by over 3 million people every year. On weekends and holidays, the zoo takes on a bustling carnival-like atmosphere with visitors from everywhere. For many of them, a day at our zoo is their first or closest encounter with the marvels of nature. Among the most popular animals in our zoo are the big cats. The glass frontage of our cheetah and leopard enclosures provides an amazing viewing experience. Leopards may be the most agile predators, but their cousins next door are truly awe-inspiring. This handsome fellow is Prithvi. Like most of the tigers in our zoo today, he was born to Manya, our white tigress. Manya herself was born at our zoo in 2005 and has produced many cubs over the years. So far, all of them have been normal-colored tigers. One fact that you may not be aware of is that, unlike in the old days, zoos in India are no longer permitted to capture animals from the wild for exhibition. So, to ensure that we always have a variety of animals, we depend on exchange programs with other zoos as well as captive breeding. Animals born and raised in captivity are well adjusted to zoo life and thrive when provided proper care. This includes spacious enclosures enriched with features that simulate natural habitats. Well-designed enclosures not only have aesthetic appeal, but also create a sense of comfort and well-being for the animals. This rock in his enclosure is a habitual vantage point for Darshan, our own Lion King. The earthen mound in their enclosure is a favorite spot for our Indian grey wolves. Most of the wolves in this pack were born and raised in our zoo. Here they are at just a few weeks old. Their mother Rani did a great job of raising them to adulthood. Across from the wolves are the dholes, which are also known as Asiatic wild dogs. They are smaller than wolves and have a shorter snout. Like wolves, wild dogs also hunt in packs and can easily bring down prey much bigger than themselves, such as the sambar. Sambar are fairly common and widely distributed in India's forests. They are the largest deer in Asia, and a stag can weigh 350 kilos or more. Far heavier than the sambar are the gaur, the largest wild cattle in the world. A bull stands 6 feet at the shoulder and weighs close to a ton. At the other end of the spectrum, we have one of the smallest herbivores in the world, the Indian mouse deer. An adult like this one stands just 13 inches tall and weighs a mere 3 kilos. Towering over all our other animals are the tallest mammals in the world. A male giraffe can grow over 18 feet tall and weigh more than 2,000 kilos. Because of their long legs, eating anything on the ground isn't easy. So we hoist their food up on a pole. A giraffe can extend its tongue by as much as 18 inches. This enables it to pluck leaves high up in the canopy. Most of the giraffes in our collection were born here and continue to breed well. At over 4 tons, the heaviest animal in our zoo is Rambo, our African elephant. Rambo is rarely seen without his faithful sidekick, a yellow-billed egret. The elephant's dung attracts insects, which the egret is quick to snap up. Rambo is now in his mid-20s, and we hope to find him a mate soon. Next to Rambo's enclosure is our herd of Asian elephants. They are extremely fond of water and love to splash around at every opportunity. They are the most pampered animals in our zoo and even have their own shower. Elephants have enormous appetites and must be fed throughout the day. We give them a combination of cooked food, fruits, vegetables, and grass. Keeping our animals well fed and healthy is our top priority, and it's quite an exercise. Every day, truckloads of food arrive at the zoo, bringing 300 kilos of meat, 400 kilos of fruits and vegetables, 750 kilos of grains, pulses, and bran, and 6,000 kilos of grass and green fodder. Only the freshest and best grade of food is fed to our animals, and all items are subjected to stringent quality checks. Our kitchen staff prepares the right type of food for each species. It's a race against time every morning, catering to the many hungry mouths waiting for their breakfast. Irrespective of holidays, bad weather, earthquakes, or riots, food has to be delivered several times a day to the enclosures. Of course, where there's an abundance of food, uninvited guests are never far behind. Many free-living creatures benefit from the banquets that are spread for our animals. In turn, they add color and gaiety to our zoo. Some of our birds and animals need special food. These scarlet ibis get their bright coloring from the beta-carotene in the food they eat. So to keep them looking beautiful, we include shrimp and grated carrots in their diet. We also breed and raise mealworms because some animals need insects in their diet at least a couple of times a week, like this African bat-eared fox. We have several species of crocodilians in our collection, and they are fed fish on alternate weeks. Our otters, on the other hand, need fresh fish every day. Here comes their keeper with lunch. Visitors to our zoo might regard the animals they see as just specimens. But to us, each one is a distinct individual with its own personality. Mason, one of our chimpanzees, likes to wave at his admirers like a music conductor. Abi, one of our Asian elephants, loves to make his own straw hat. He'll put it on and take it off several times a day. This ostrich pair might look like a happily married couple, but for some reason, the male seems to regard his keeper too as a potential mate. Anytime he's nearby, the male will woo him with an elaborate courtship display. Our sloth bears, Ganesha and Durgi, also have distinct personalities. They were raised together as cubs and are very attached to each other. Ganesha is the adventurous one and is always getting up to some mischief. His mate Durgi, on the other hand, likes to take it easy. Whenever Ganesha gets bored, he will cajole the reluctant Durgi into a friendly wrestling match. It's all in good fun and no one gets hurt. Animals at the zoo can also exhibit a surprising level of intelligence. Using a rock to relieve an itch is nothing unusual. But using a branch as a back scratcher? Now that's clever. When his keeper enters the enclosure every morning, Krishna, the hippo, will literally demand a mouthwash. Our male Indian rhino, Virat, knows exactly when it's bath time. He will walk to the bathing area without any prompting and won't leave until he's received a thorough wash. Like Virat, many animals at the zoo develop a close bond with their keepers. But don't be fooled. Only their keeper can get this close. Zoo animals can be very dangerous, and the rest of us must always stay behind the railings. However, if you would like a closer bond with our animals, you can participate in our adoption program and sponsor the upkeep of any of our animals. As a sponsor, you will get special visit privileges, and your support will help take care of some of our feeding expenses. When you see healthy and happy animals at our zoo, it's thanks to the elaborate management protocols we have in place, which are implemented by a staff of nearly 300 people. You may not notice them, but they are everywhere, quietly doing their jobs. Keeping enclosures clean and regularly disinfected forms a large part of every keeper's duties. The main gate and entrances to other sensitive sections also have disinfectant mats to minimize the spread of diseases. Preventive medicine, too, is a crucial aspect of our animal healthcare routine. Today, our veterinary team is preparing to vaccinate the giraffes against foot and mouth disease. The syringe is loaded into a special gun and then fired into the animal's rump. The big males barely flinch when the dart hits home. But next door, the females and their young are already nervous. One by one, the doctors get them all. The vaccine gets injected within seconds after the dart pierces. A couple of flicks of the tail and the dart falls off and will be collected by the keeper. Animals can also get affected by ticks and fleas. Today, it is the turn of these barasingha or swamp deer to receive their periodic treatment for ectoparasites. An organic insect repellent is mixed with water and sprayed in the form of a fine mist as the animals gather to feed. Despite all these precautions, however, animals do get sick sometimes and are treated at our zoo hospital. This sloth bear has been tranquilized and brought in for an X-ray and an ultrasound. Once the doctors diagnose the problem, the animal will be treated and closely monitored. The zoo hospital also houses our animal orphanage. This is Chamundi. She was found abandoned in the wild and sent to us when she was just 6 months old. Her keeper feeds her a special milk formula several times a day. Like all youngsters, Chamundi can be greedy. After gulping down her milk, she will raid her playmate's lunchbox. The Gaur calf must eat quickly before Chamundi finishes everything. Meanwhile, it's feeding time for the other orphans. Sometimes, babies born at the zoo are not properly looked after by their mothers and have to be painstakingly hand-raised. These hyena pups are just a few weeks old, but have insatiable appetites.
Hey.
They are absolute rowdies and can be quite quarrelsome at feeding time. One of our most popular exhibits is our newly redesigned snake house. Here, you can come face to face with the heaviest snake in the world, the green anaconda from South America, or the longest venomous snake, Asia's king cobra. A male like this one can grow to 18 feet in length and raise nearly 1/3 of its body off the ground. Our walk-in aviaries are also popular as they allow visitors to stroll among the birds. The star attractions in this aviary are the black swans. Our zoo has been a great venue for inspiring a love for nature in young minds. Every year since 1992, about 60 students have been handpicked for a year-long program involving lectures and field visits. The students are taught various aspects of nature conservation, which we hope will instill a lifelong empathy for the natural world. We also pride ourselves as a clean and green zoo and recycle much of the organic waste that is generated. Mega herbivores like rhinos, hippos, and elephants eat vast quantities of food. And of course, what goes in does come out. Our keepers have their work cut out, clearing these mini mountains of dung. We ensure that none of this waste goes to waste. From the pens, herbivore dung is sent to our vermicomposting yard, where it is slowly converted to a rich natural fertilizer that keeps our gardens lush and lovely. The best time to visit our zoo is in the morning or the evening, when animals are at their most active. From entry to exit, the pathway through the zoo is 3.2 kilometers, which you can cover in just a couple of hours. But we recommend that you take it slowly to get the most out of your trip. But do avoid the middle of the day if you can, as it's a time when most animals rest. While most visitors come to our zoo to see animals, we also have a great variety of trees from all over the world. Some are as old as the zoo itself. For over a century, these grounds with their magnificent trees and animals have been an important part of Mysuru's rich heritage. It has been our constant endeavor to provide the best conditions for our animals and to ensure that visitors have a memorable day at our zoo. We are immensely proud that what started as a Maharaja's private menagerie has evolved into a vibrant and dynamic public institution. With your continued support, we hope to make Mysuru Zoo even better in the years to come.
So, hello everyone, good afternoon. So, I welcome you all back to this session on the day two. So, today we have our second speaker for the afternoon session, that is Dr. C. Veterinary Officer, Tiger and Lion Safari, Tavekopa, Shumoga. So, today he would be delivering his presentation on role of zoo veterinarians in rescue and rehabilitation of wild animals. Over to you, sir. Sir, you're not audible, sir.
Am I audible?
Yes, sir. Yes, sir. You're audible now.
Okay, I think the mic doesn't work. Okay. Yeah. So thank you, Sneha. Very good afternoon to all of you who's joined um the webinar. Today, I'll be speaking about the role of veterinarians in rescue and rehabilitation of wild animals. I am currently working in Tiger and Lion Safari, Shimoga. Yeah. So before I begin, I'll give my acknowledgements to all the institutes who have, helped me to come up with this presentation. Um, my personal acknowledgements to a lot of people who have actually contributed to this field and helped me make the presentation. Uh, thank you all. So let us begin with understanding few terms which we come across in rescue. So the first thing would be the rescue. So what do you mean by rescue? The rescue means, when you understand it, uh, it is either shifting an affected animal from impending danger, mainly which is man-made or natural calamities, shifting the ailing animals to the nearest veterinary care facility for its speedy recovery and eventually rehabilitation as per the protocol of the state and the country. So another thing, what we call as the release. Release means to liberate or let go of an healthy individual from a natural habitat, preferably in the same region or a previously selected site or a landscape. Rehabilitation. The goal of rehabilitation is to mainly provide professional care to a sick or injured, orphaned animals, which they can eventually be returned to their natural habitat. Okay, so a veterinarian plays a very important role in assessing the health of these animals. Again, a conflict literally means incapability or a clash between two individuals. Interface, yeah, uh, it is a common area where a two individual means, in this case, man or an animal, where they meet. Then we come to man-animal interface. So man-animal interface is a region where the wild basically meets humans. Yeah. So, but this area doesn't involve any conflict situations. Now, the pressing topic: man-animal conflict. So the incompatibility or clash between a man or a wild animal or an animal with another animal, resulting in injury, discomfort, stress, loss of property, or death. So this is a real situation of a man-animal conflict. The word hotspot means where a lot of conflict cases happen in an interface area. It can be because of various issues of socio-economic, political, ecological, environmental causes. Okay, so once all this is done, there are certain cases where the animal cannot be released into the wild. So the rescue center comes into the picture. So the rescue center, uh, basically houses man killers, senile animals, injured animals, young animals, which cannot, be left out in the wild on their own. And our Central Zoo Authority has has made a proper guidelines how to establish a rescue center. Yeah. So even in the rescue center, which are non-conflict animals, if the animal has to be released into the wild, further soft release protocols, other things can be decided by the state, and it can be done. So this is a slide showing just diagrammatic representation what is happening. Okay, these are just pictorial representations of where the animal is being attacked by people or animal is attacking people, and this is actually a conflict situation where things are out of hand and there are no support system to handle this situation. So as an administrative person or a forest officer, veterinarian, police officer, fire force, press, media, public, all these play a very important role in actually assessing or to conserve the wildlife in the field. It is a bound duty of all of them. Not only a one-man show, not only one veterinarian can run the show, or not only a forest official can run a show, or probably not only police can run the show, but all put together, we can avoid these complications which could happen to these wild animals. Yeah, so we all know that the natural forest cover is decreasing day by day. Now, what is rescue? Rescue is not necessarily capturing an animal and shifting it to another place. So we need to understand why we should rescue an animal and how we should rescue an animal. So a situation A where you see the leopard is taking her two cubs. There might be another cub somewhere where she would come back and take the cub. So when we take the cub from that place, it is not called a rescue. We should probably wait for some time for the mother to come back. The second situation where the leopard is in the well, a simple ladder has been put for the animal to come, and the crowd is also not there when you see this picture. So the animal is coming out very happily. So we need to know why we have to rescue and when we have to rescue. So these are some general things which I will be talking today. I won't be stressing much on anesthesia because it is been covered by my colleague in previous presentations. So no much details about anesthesia will be told here. Yeah. So we have certain criteria when we approach an animal to be followed. So one is there are some factors which we have to consider before we approach the animal, and the second, some factors which we have to consider are like post darting the animal. So how best we can shift the animal from the place. Again, uh, uh, what is the role of veterinarians? Where all does a veterinarian play an important role in the field? As a zoo veterinarian, as a wildlife veterinarian. So these are some things where a veterinarian needs to uh, uh, is required. So one, for disease diagnosis and treatment of animal, then translocation or transportation, reintroduction and restocking. We need to, assess the area, see whether they're compatible group. Displace of nuisance animal, displaced animal, management of problematic animal. Yeah, we all know that. Wildlife research and conservation, we all play a very important role in that. Biological sampling and species and biological data. Sometimes some new species has been, discovered or something. We might have to pitch our view in there. Okay, so this slide is depicting where the animal is got uh, to officials because probably lack of response time or anything. Um, but this situation should never happen. Our response to any situation should be very fast, and we need to control uh, before it becomes a conflict. Now I'll be talking some scenarios which we all have encountered in the field. Uh, we use different types of methods to, rescue these animals. Situation A, where the leopard is in a dry well, probably 30 to 40 feet long well. It is not covered in a rural area, so the animals would have, by chasing some other prey, it would have fallen inside. How do you take this animal out? Yes. One, we can dart this animal so the animal sleeps. Second, how to get down? We can use the help of fire department. They'll have a very long ladder so we can get down. And then through suitable approach techniques, which I'll be talking, we can approach the animal and then we can lift the animal and then transport to another suitable location for release. Second, the animal in a wet well. So if the well is small, like you see in the image, the water can be drained out of the well and the animal can be taken out. Or if the well is too deep and the water is full, you can actually introduce water to the well and the animal comes out by itself. Three, if the well diameter is very big and you cannot dart in these situations because animal will drown, what do you do? With that background, first we have to consider the life of the animal is very important. So to prevent the animal from drowning, we would rather put a log or a cot which is available everywhere so that the animal can stay on the cot for some time till we follow the next step. Ideally, what could be done as the next step is we can introduce a cage inside the well so that the animal can get into the cage because it doesn't have any other means to go, and it can be locked and then shifted and released to a nearby location. The similar thing, this is another image of mm, a leopard in a dry well where darting can be done. So this image shows the animal is in a snare. So there are two possible outcomes where when the case has been reported. One, the animal has been caught in a snare and it has been reported immediately. Two, the animal is been there for some time and people, out of being scared, will fail to report the case. When we get the information about the case, the only way you can take this animal out is again by darting. So after we relieve the animal from the snare, we have to observe the animal for any physical injury or any long-standing injury. If there is nothing, the animal is set to go. Or if there is any, deep injuries or cuts due to the snare, the animal might have to be shifted to a rescue center, and depends whether it should be released or not released, it should be taken by the state. Here are two pictures again showing where intervention is required. Picture number 2, definitely this animal cannot go back to the wild. Picture number 1, he's a very good healthy adult above 7 years of age, I can say. The only problem which he had was a little nose injury, little epistaxis was there, and that also is because the animal hit itself on the transportation cage. This animal is very fit to be released into the wild. Jaw traps, very common again in this country. Recent days, they have become very less. As you see in the image one, there is a lot of necrosis in the leg. Image two, you can't see. Probably once you examine the animal, if the leg is damaged beyond repair, it has to be shifted to a rescue center. These are another two scenarios where intervention is required. One, uh, inside the leopard gets, or an animal, any wild animal, for example a snake, also gets inside the house, uh, mm, we might have to reach the place immediately and rescue. So in case of larger mammals like leopards or sloth bears, darting is an option. And the second scenario, where the animal is being chased by people, a lot of police protection and other things will be required to contain the situation. Yeah, so this is another situation where the animal has gone inside a house and has to be taken out. So we have to see a right place to stand for darting the animal. If the windows are not accessible, then the beams of the roof can be actually used to dart the animal. If at all the animal jumps, you won't fall with the animal inside. So yeah, we use the beams of the house to get our grip steady. These are again some problematic animals which in Karnataka, where rescue has been done. One, it is in a deep forest, and two, these are coffee plantations where rescue was done. This is again a team showing, rescue preparations and operations for finding the animals. So we have to go through a lot of hardships. There is no accessibility of road. Most of the time it is on top of an elephant. Yeah, so okay, this is an easy one where the animal was in the field, and there are less dangers which I'll be talking about further. So whenever you're we're doing a rescue operation, there are two aspects which you have to consider: physical, chemical, or combination of both. So generally combination of both will be an ideal structure for an ideal rescue. So physical restraint, as you can see, this is a young leopard which has been caught in a very bad way. So there are different things. There is a trap cage, drop nets, trap nets, Irish foot snare, pit trapping. So what you always have to remember is the animal is in a lot of stress. In a zoo condition, the animal will be used to these conditions, and animal will be conditioned for the people. But what we have to understand as a freelancing wildlife veterinarian is the animal will definitely be under a lot of stress, and it is not used to humans. So physical restraint for a bigger mammals is definitely not an option. Then we go to chemical restraint. You have different types of drug delivery systems. So this is a jab stick where it works in the principle of a spring. You touch the animal immediately. So this can be used only for a severely compromised animal or a slow moving animal. But definitely, preferably a barrier should be there in front of you when you are administering with the jab stick. You have the blowpipes, which has been told. Uh, then you have projectors. So they use a small charge. It contains gunpowder. These projectors are generally used for capturing large mammals, probably gaur or elephant, rhino. in the wild. But nowadays, pneumatic projectors have replaced these things and they're doing an equivalent job. So this is the structure of the DAT syringe of a charge operated projector. They have a barrel, tailpiece, needle, plunger, and a piston. So this is also a charge operated piston. This is the final assembly, how it looks. You have a pneumatic drug delivery system. So you have different models. You have rifles, and you have these are probably from Dining Jet company. So the syringe appears to have three parts. One is the needle, then the body and the tailpiece. The body is generally divided into two. One is the drug chamber and then the air chamber. You can fill air into the air chamber through this syringe, and the top where the needle comes, it has to be covered with a sleeve. So all these things are very important in case of a rescue. One small, the sleeve you forget to take, the entire operation goes for a toss. So we really don't want that to happen. A really good planning is required when you are going for a rescue. So let us consider some general preparations which we have to uh, take in mind to immobilize an animal. Initially, the major point is the animal. So the type of animal, what it is, first the normal behavior you have to know. So every animal will have different behavior. You cannot treat an elephant, tiger, bear as just an animal. So elephant will have a different behavior, tiger will have a different behavior, leopard will have a different behavior, rhino or any gar or any animal we take, they have a different exhibiting of their natural normal behaviors. Only when we know what is normal, we can able to assess what is abnormal. Then the age of the animal, if it is too young, what do? The drug will be required very less. If the animal is old, the drug required will be less. The sex of the animal, whether it is male or female, if it is female, if the animal is pregnant, so that will also come under physiological status of the animal. The emotional state, as I can say, if there is a mother taking care of the young one, it is separated from the young one, her emotional, like when we capture elephant, we might not have proper history whether she is lactating a young one, because it will be in a herd, whose young one it is we might not know. So sudden operations when we go for, we should take these into considerations. So if it is a fat animal or a lean animal, sick animal, emaciated animal, we really will not have any information about these things in the field. All the only information which we get in the field before we even climb onto the animal is probably a photograph of an animal, and that too a very bad photo, and only one part of the animal seen, or only the tusk seen of, in case of elephants, or in case of a tiger only the rump seen or only the face seen. We really will not have any information about this animal before we go into the field. We do not know the body weight of the animal. Someone says it's 150, someone says it's 200, it's a big tiger. Sometimes it may not even be a tiger when we go there. Yeah, so these are some challenging situations which we will be facing in the field. Yeah. The second factor is the environment. This plays a very important role uh, mm, in carrying out any particular rescue operation. So one is the terrain. It is a hilly area, it's a coastal area, it's a swampy area, and the escape cover for the animal. As you've seen in the previous slides, if it's in a rainforest, the animal has, after darting, it takes a few time to sleep, and it can go anywhere. The time of the day, we have to select the time of the day. Probably, preferably, will be darting the animal during the daytime, where it is easy to find the animal after darting the animal. The seasonal variations we have to consider. Most probably in South India, the season is not much variation. The temperature more or less remains the same. But in other parts of the country, we have to consider seasonal variation. If there is any water body nearby, we might have to wait for the animal to get away from the water body to dart. Then the ambient temperature and metabolic temperature, which we have to consider once we approach the animal. Second, the third thing is drug and equipment. So we have in current day a lot of drugs which can be used, but as a veterinarian in the field, you cannot make any error. So what I suggest that we use that. Experimentation in the field may not be very successful and may not give desirable results. In the zoo, generally, we will be working with the different kinds of drugs to see the response of the animal. The same thing, but when you're going in the field, use the drugs which we are very comfortable with. The choice of the equipment what we are using, there are different companies which comes for darting in India. We can just go what we are comfortable using them. Do not invest on something fancy looking equipment and finally you cannot handle this equipment. Equipment failure will obviously be a problem. The another thing is the safety precautions. As a veterinarian, it is very important if we are handling any animal, there can be zoonosis like tuberculosis or rabies. Uh, Without knowing the history of the animal, we'll be working with close proximity of the animal, oral cavity. Uh, we might even breathe the same air of the animal if it's in a closed space. So, zoonosis is a very important thing to consider for a veterinarian. Self injections, as it was discussed in the previous presentation, drug spillage, yeah, we have to take utmost care to prevent this. And I have mentioned tranquilizing team because it is never a one-man show. One person or one doctor or one forest officer cannot uh, uh, handle any situation well. If it is a team who is seasoned for a regular operations, then only your time for um, capture will be very less and be very efficient. Otherwise, it's going to be really difficult. Okay, so there are, as I said, there are different ways of capture. The first thing is the trap cage. It is the most easiest thing what you can do. The only thing what you have to do is place the cage in a right place and camouflage the cage. So this is mainly for free-ranging leopards or tigers. This can be used, or even sloth bears. So only thing is it doesn't. This is a physical form of restraint, and no chemical uh, darting is required. Yeah, so positioning of the cage is very important. As you see in this particular image, the cage is being positioned away from the path of the animal. There is no way the animal is going to cut through all these leaves and go inside the cage. Even though the cage is well camouflaged in the night, the animal is not going to go inside this cage. Positioning of the cage is important. So as you see in second image, the cage has been camouflaged really well. These are some camera traps image showing the leopard actually going inside the cage and examining. And the bottom two images, the tiger doesn't even go inside a cage where it's not, decorated properly. Pitfall traps, they are using these, but they have their own demerits for a pitfall trap. primary demerit being the animal getting out of the pit hole trap. The trap is too deep, animal might break its appendage or have an internal injury, animal might die. We generally pitfall traps are very less used. Alred's foot snare. So this is a scientific snare without any sharp edges or tightening very hard. The animal, this is placed in two strategic positions, and when the animal falls, it can be even connected to a radio transmitter where the information of the animal will be uh, uh, relayed. This is the preparation where elephant or a tiger captures scenario happens. This is just preparation phase, and then before going, a puja is done for for the operation to go well. This is searching for the animal in the wild. Probably most of the days will be fruitless. Eventually, a successful operation will happen. This is a consent form which is being practiced in various places where a veterinarian tells what is the problem or what he can assess and why the anesthesia is required. Since I have mentioned before, there is no proper history of the animal. We do not know what has happened to the animal. Uh, there is no history. We are just going in blind without even seeing the animal. We are loading a dart and we are darting an animal. So, well, in case of pet practice and other things, a consent form is a must. So this is just introduction of that, which could be followed. The risks are mentioned very briefly by the veterinarian about the consent or the different types of problems which can occur with anesthesia or without anesthesia due to an underlying disease or a lot of other things which are involved. And our main disadvantage in the field is we do not have, number one, all the equipment which we require to sustain life. It can be an emergency unit for a ventilator or even an oxygen cylinder. We may not I have seen in so many places where it is not possible to take this into the field, and top of an elephant back will be going, will be sedating the animal, it gets into an emergency, you don't know the history. It is very difficult for a veterinarian to work with basic two suitcases what he has to hold in his hand and work. Mm. Another thing which every veterinarian should follow is consent for this is a immobilization sheet where generally the uh, details of the animal is mentioned over here. What drugs can be given at what rate, what route, at what time it is success of delivery, effect. And some physiological data can be recorded, like heart rate, respiration, temperature, pulse, oxygen saturation, capillary refill time. So based on your needs, you can formulate a data sheet, what you want. So, it is useful. So this is a data sheet which we follow in our zoo. Again, briefly, we talk about the darting sites. In case of a tiger, you can go for, triceps, biceps, and the gluteal muscles. So if it is presented in this way, most of the times it won't be presented. So these are these preferred sites. So this is one of the dart, where it can go to a different place and be not. Um, suitable for the animal. So the neck region has two major thing. One is the carotid artery, and the second being the respiratory tract. With that intensity, if the dart punctures the carotid artery, there might be possibility of rupture of the carotid artery, or if it gets into the trachea, there is a possibility of anaphylactic shock, compression of trachea, and other things. So, what are the challenges which we face in the field? Yes, as discussed in earlier presentations, we might not get the entire animal. So this is the only place where we could dart an animal in this place. So only the head of the animal is seen. So it is very difficult to approach. The second, it is in a very thick plantation, bamboo plantation, where approaching the animal is very difficult. There is, and you will have to go and dart it because there is no other option. So uh, how do we protect ourselves from the impending danger? We have to consider. The second problem is the identification of the animal. In a particular area, there will be many animals. Like, for example, we were tracking a leopard in Bellary district of Karnataka. In a area of around 7 square kilometers, we found about 10 to 11 leopards. So, which leopard to that? Yeah, which is a man killer. So we don't have that data, and we might have to spend a lot of time in narrowing down the path of the animal, and finally luring that animal to some place and dart the animal. The second thing is the water hole. Water hole is a very stressful situation. If we dart this animal, it might just uh, sleep near the water hole or on
Due to some network issues, Dr. Sujay is actually facing some problem. So he'll get back to us very soon. So I request all the viewers to just wait for some 2 minutes. Thank you.
Am I audible now?
Yes, sir, you're audible and your presentation also is viewable.
Uh,
So please, okay, fine, sir.
yeah. Sorry for the inconvenience. There's some network issue. So let us go further. What are the limitations we have in man-animal conflict situations? One is the crowd or the mob, where the crowd or the mob comes in between any rescue operation. We cannot do it in peace. More or less, the animal is eventually affected, and procedures will be delayed, and there will be a lot of disadvantages. Then the predisposing disease conditions, if there are any, or body condition of the animal, we cannot assess them prior to darting of the animal. Only after darting we will get to know these conditions. Positions presented by the animal. Uh, so as I showed you in the previous picture, the head, generally carnivores, they present their head if they spot you before. It is very difficult to dart at such time. Then another important thing is the equipment failure, where we lose air in the pneumatic drug delivery system, or the dart doesn't fire, it gets obstructed, it goes to a different place. These are some equipment failure which we come across. Availability of suitable immobilizing drugs. Most of the drugs which we use in our country is being imported from another place. So most of the people may not have accessibility to these drugs, and even though they have accessibility, and during these recent times also get procuring these drugs from another place is not been possible. So that we have to work on. The dart failure can be of two things. One, failing of the dart to hit the animal. Two, the dart hit the animal but failure of delivering the drug to the animal. So these are the two dart failure things which we should keep in consideration. An untrained team will be a chaos. A work which can be done by a trained team in 5 minutes, with an untrained team, it will take more than half an hour to do the same job, and not with efficiency and with lot of loopholes. Probably if you're doing alone also, it might take a little lesser time because you need not have to micromanage the team. The lack of suitable equipment or cages post immobilization, which we will not have in the field. One, there won't be any road access sometimes. Sometimes the nearest road will be a few kilometers away after we dart the animal. So we have to think how we should lure the animal to these places and then carry out the procedures. Vehicle, yeah, as I said that the animal attacking the team to close proximity. This is the major limitation of any veterinarian. He has to go to a very close proximity, probably 50 meters is the farthest he can go if there is no clearance. But if there are bushes, shrubs, anything, a veterinarian or his team should go really close, and then that the animal which uh, precautions have to be taken, and I feel they have not been taken in the field. Improper immobilization, less or more, can also be a problem. The post-immobilization emergencies, what we should consider is trauma. Animal may have fallen from somewhere. There might be pre-existing trauma to the animal. We have to see whether that prolong. We have to see how to prolong the life of the animal so that further treatment can be done. Overdosage or underdosage of the animal is a very common issue where, because we do not know the body weight of the animal and the underlying cause of the disease which the animal is being presented. Also, most of our drugs have a large margin of safety. Even for xylazine, if you take, it has a very good margin of safety for about 20 to 25 milligram per kg IM, which has been also published. But other underlying causes might be very challenging issues to take care of. Hyperthermia and hypothermia. Hyperthermia is another common thing which we come across, and most common mistake what we might do for hyperthermia is to just pour 1 or 2 buckets of water onto the fur animals, and then not look into it. So what does water do for fur animals? It will act like a blanket, and it will not allow the heat to escape the animal, and it becomes a problem. So instead of water, we can easily switch on to alcohol, which is more, uh, it absorbs the heat from inside the body. Ethyl alcohol can be used for this, for controlling hyperthermia. Hypothermia, as you all know, you can use blankets, heating pads, making an environment cozy for the animal. Hypoglycemia is another condition which we do not know in the field. We do not know when the animal has eaten. So probably after sedation, animal might even go for a shock or a coma, which we think it might be drug induced, but it is, even after we revive the animal will be still in phase of shock. So it is best if all the veterinarians have a small glucose meter in their hand to check the capillary or any venous uh, blood glucose level, at which we will get a rough idea in the field. So we need to know what kind of infusions we should give to the animal to keep it under normalcy. Malpositioning problem is the major issue for most of the animals which have been transported with sedation. So we all know that the muscle relaxation is there in case of sedation. So when you transport an animal with sedation for a long distance, what happens because of the humps of the roads, the position of the neck will be compromised. The animal may not be able to breathe. So we will be losing the animal just because of malpositioning problem. And in most of the Indian scenarios, when the animal is transported, uh, there will not be any para-veterinary care or a veterinary care who is sitting next to the animal, because the animal will be in the cage. It's very practically not possible. We do not have much ambulances to do this transportation. Even if we do, there are possibilities of animal getting up inside. So cages are the only way. Uh, it is of my opinion to partially revive the animal so that the animal can breathe easily during transportation. Capture myopathy, it has been discussed. There are 4 types. Most of the cases which do not die of capture myopathy in the initial time and they go to another place and die after a week or after a month uh, is mainly neglected uh, of capture myopathy. But Capture myopathy can be the cause of those deaths where the animal go to another place and after a few months or few days, the animal might die. That also we have to consider for capture myopathy. So how do you approach the animal? So one, we need a four-wheeler because these animals are fierce. If there are small animals, it's okay. If there are bigger animals, you need a four-wheeler. Then a captive trained elephants are required to approach the animal, or race machans. We have to wait till the animal sleeps. And you need a overriding degree of patience. Without patience, if we hurry to anything, one problem can lead to another problem. As my colleague had discussed, how to make sure that animal has entered the plane of anesthesia, you touch the sensitive organs like ears or nose to see whether the animal has slept. So to do that, you need to approach the animal in the right way. If in the zoo it is okay, you have a barrier, but in field you do not have the barrier and your life will be a barrier. So we do not want that to happen. A lot of field experience and anatomical know-how of the animal is required. So this is a way where you approach in a Kumki elephant. This is the way where we approach in a four-wheeler. These are some body protection kits. These are riot boards which we see. They're taken from different departments of the country, forest departments of different states. So these are some gears which we require when we approach the animal in the wild. As you can see, there is a team over here who is very close to this tiger. And for example, this tiger hasn't slept. I don't know what will happen to this team. So a very good care has to be taken while approaching the animal. Most of the wild animals also they fake their sleep sometimes. Only when you get closer, they may just sit up and stand. We have seen those situations also. So be very careful when you are approaching an animal. Induction phase is something which all of them should know, and all of them other than the veterinarian group has to be educated when you are doing any such any procedures. So everyone has to realize that when we are darting an animal, it takes generally 15 to 30 minutes, which only veterinarians will know and some forest officials will know, but none of them from the police or other people will not know. We have got a lot of hindrance from the police department and other people who they think the dart is like a bullet. As soon as it hits the animal will sleep. But that is not the scenario. So they have to be educated before we start the procedure. Okay, safe distance and crowd management is again I have told as before. So this is a scenario where there were a lot of people while handling a case. The area was cleared, the animal was approached, and yeah. So handling of immobilization animal. One thing, you have to approach these animals very quietly. One, removal of the dart is important. It has happened few to many people that the animal has left, the dart was not removed, the animal recovered, and the animal went with the dart. So we do not want that in our hands. So removal of the dart, blindfolding, and ear plugging of the animals. Positioning, as I said, is very important, and ABC is the thumb rule of all the veterinarians. This is some pictures suggesting, eye closure, ear closure, opening of airway to breathe, the final release procedure. So at the end of the day, what we have to consider is human safety and animal safety. So here, the animal can easily access the leg of this man if he comes a little closer. He doesn't even know where the hand of the animal is. So human safety is very important. Animal safety, this was a completely healthy animal. Before putting it into this cage, he had all the teeth, all the claws, and now this animal cannot be left out in the wild because of these bars. So these are some scientific cages which we will have to consider. The image 1 will not follow. 2 and 3 are ideal for the animal to be transported. So one is made up of wood and the third one is made up of a fiber. Most of the time we are supposed to work with only these cages because of lack of funds or whatever. Scientific cages are not yet being made. So we have to cover those cages with something, whatever we have, to prevent the stress of the animal. These are some photos showing transportation of elephant from one place to another. It is a very good view for everyone and very stressful for the animal also. If there is any closed vehicle, we can use that as a transportation of any elephant, any larger animals from one place to another. I have shown this photo to gauge the weight of this particular tiger. Uh, we generally say a female weighs about 150, male about 180 to 200, but that may not be always possible. Only when you weigh the animal and when you have experience of seeing this, then only you will uh, gauge the actual weight of the animal. We never thought this animal was only 90 kilos. So there are some preparations which we have to take. We put these things into our kit when we go to the field. There will be antibiotics, painkillers, antacids, anti-maggots, B-complex, uh, bleeding arresters, hemostats, some sprays and fluid therapy. We have to consider. So general considerations for handling an animal is one, the identity of the animal. So what animal you are handling, that equipment you have to take with. If you're handling a gaur, you have to take ropes. If you're handling an elephant, you have to take ropes and other kumki elephants. Or if you're handling a tiger, you need right things to handle the animal. Then age, sex, I have mentioned. So monitoring these vitals during any rescue procedures are very important. We don't know when things will go south. So our main motive during any rescue rehabilitation process is the life of the animal. Once the life of the animal is stabilized, only further things can be planned. Without life, there is nothing to be planned ahead. Yeah. So there are something considerations for release and rehabilitations. One is the physical health, as I said, the age of the animal. If the animal is too old, it cannot be left into the wild. If the animal is too young, it cannot be left into the wild. If there are any injuries or permanent injuries or trauma, again, it cannot be left back into the wild. History why it was captured. So if it is a man killer, crop raider, cattle lifter, with this history, again, we have to consider that these animals cannot be left back into the wild. Okay, so not all captures should end up in a rescue center or zoo. So once you are pressured with many situations, you should not always send the animals to the zoo for further, because that is a dead end where the animal will never go out and see the world. So this is an overall nutshell of a rescue. This is under a bush. The animal was sedated, examined, transported, shifted to a cage, and then released to a nearby area. So we can also use a lot of modern techniques like radio collaring to monitor the animal. Um, so here I would like to discuss a few things to know the age of the animal. We generally use the canines. So this is a very young animal, about 3 to 5 years of age, and this is about 6 to 8 years of age. I can say the canine is very prominent. There are no milk teeth, which is ruled out that it is below 1 year of age. As you can see, there is a small groove which is coming in the lateral aspect of the canine. In case the animal age advances, the canine becomes yellowish and the groove becomes darker because of dirt accumulation. So that is how we generally estimate the age of the animal. And if there are no three canines, you cannot release the animal back to the wild. Again, if there are no claws, especially in the forelimb, there should be at least three claws in each paw to at least make the animal hunt. If there are any lack of claws, the animal should not be released back into the wild. So release and rehabilitation is a very interesting chapter for everyone. Uh, so a site selection has to be made where the release has to be done after capturing an animal. We really don't know where. Generally, it is best to release a non-problematic animal to the same area, which may not be accepted. But again, selecting a new site is always a questionable uh, thing. Okay, you might have to go for another methods like radio coloring the individual and so to select a new site, some scientific methods have to be involved, like the prey
Sir,
estimate.
sorry to
Yeah,
interrupt you. We are running out of time, sir.
yeah. There's only two slides left.
Okay, okay. Thank you, sir. Thank you.
Yeah, yeah. Yeah. I'll be just brushing through this. Uh, so there is you have to estimate the prey of this area, vegetation of this area, occupation surveys can be done, and prey and predator occupying that area. You will get a data of all these things. Some species which are compatible are in a competition. So we have to consider this when we are releasing any animal to another place, where most of the time these all these factors will not be considered. Soft release is also a new area where it is been successfully practiced. Most of the animals, I think even Mysore Zoo has released a lot of animals by this soft release method. Uh, Radio coloring of selected individuals. I'll just show some slides after this. Monitoring of these animals after release is also very important. Most of these jobs will be done by biologists, and veterinarians will be assisting in the procedures. So this is a tiger, a man-killer tiger, which was released from Chikmagalur. It was an ideal plan to be released in Dandeli, but unfortunately the tiger was released in Bhimgad, and where eventually and this is also a typical example of uh, radio collar didn't work, equipment failure. Again, tiger could not be tracked for a long time. Eventually, the tiger had to be put down. These are the recent photos where the elephants have been radio colored in Kodagu district. So all we have to remember is we have to, uh, you know, um, choose best what is best for the animal rather than what is best for us. Let the wild be in the wild. Thank you.
Thank you, sir. We have some of the questions by our viewers to you. So the
Yes,
first
please.
one is, how do we deal with capture myopathy in case of free-ranging animals in field condition?
Okay. As you all know, capture myopathy cannot be even dealt in the zoo very well. And you all know that there is no proper cure for capture myopathy. It's only, supplemental dose and again, supplemental therapy. Again, if we are getting some animals like deer and all, it is very impossible to handle. So the best treatment for this animal is giving nutritive food and leave the animal as free as possible. Yeah.
So next question is that how we ascertain big cats has established a territory after release?
Yeah, as I was discussing the same thing, I couldn't go in detail. This is being done only by radio coloring the animals. If otherwise, we won't know what is actually going wrong. Even by what do you call camera traps, you can see what is happening, but by radio collaring, you will get a right image of what is happening with those individuals. Yeah.
Okay, sir. Another one question is that is radio collaring harmful?
It has been a debatable topic, but to my personal experience, I think radio collaring is not harmful. Any particular animal, before you release the animal with the radio collar, should be soft released. It should be the animal should be viewed for a few days how it is reacting to the collar, and only after that the animal can be left out in the actual procedure, the place.
So another question, which literature reference do you prefer for estimation of age for big cats, of big cats?
Literature, I might have to get back to that question later. I do not know the literature, but generally I do not recollect the books which I have read. So I will get back to that.
Okay. Well, thank you so much, sir. Thank you so much for a wonderful and insightful presentation. We thank you from the Mysore Zoo Authority as well, and as well as viewers for viewing this and for posting the questions. So, thank you, sir. And our next presenter for this session would be Dr. K.R. Ramesh, sir, the former Assistant Director of Mysuru Zoo, and he would be delivering his presentation on zoo animals, nutrition, neonatal, and pediatric care. Over to you, sir. Yes.
Yes, it's
Yes, sir, you're audible. You're audible. Your presentation is visible, and even your video is visible, sir.
thank you, Sneha. Good afternoon, everyone. Myself is Ramesh here, and the topic allotted to me is zoo animal nutrition for today's presentation. And mainly, in this presentation, I am covering on importance of wild animal nutrition and how to evaluate the quality of the food stuff and the diet formulations being practiced across the zoos and the various feeding about the insectivore nutrition and the importance of the insectivore nutrition. And after maintaining a scientific feeding program, how to evaluate the feeding practices that are being practiced at these zoos. The first thing is importance of wildlife nutrition. See, the main objective, the prime objective of captive animal management across the globe is the conservation. The objective of captive animal management in zoo across India, the main motto is to conserve the endangered species. What has happened in the past 3 decades due to these conservation breeding programs are failed due to inadequate or improper feeding management. What I can say is the scientific feeding programs are not adapted in such in last 3 decades period. So because of that, the improper feeding causes a severe nutrition deficiency disorders, and most of these disorders goes unnoticed and undiagnosed. What I mean to say that whenever there is animals are suffering from certain diseases and conditions, it focuses on clinical knowledge only. So nobody worries about the and if you what do you call that diagnose these disorders.
So,
And,
so sorry to interrupt. Your voice is not that audible, sir.
okay.
There is some congestion, sir, in your voice.
Okay, now?
Hello.
Now?
Yes, sir. Yes, sir. We can hear you, sir.
Okay,
Yes, sir. Yes, sir.
so the challenges in animal nutrition is so the first thing is availability of research data. See, unlike a domestic animal model, Whereas in dairy nutrition, canine nutrition, feline nutrition, there is the laboratory animal nutrition. So the literature is plenty domestic model, whereas in the wild animals, the availability of basis data is very scanty. Say, for example, in Mysore Zoo, we are housing 152 species of animals, and the nutrient requirement for each and every species is very difficult to get anywhere in the scientific community also. So that's why availability of the basis data on zoo animal nutrition is very scanty. And unlike domestic or laboratory animals, it's difficult to conduct scientific experiments in endangered species also because almost all the zoos, whereas endangered species are concerned, there are limited number of population sizes. Say, for example, LTM, there will be one or two animals of the display. Similarly, almost all the endangered species, even the zoo managers are also not permitting to conduct any animal nutrition studies also because of the value of the animal. Considering the value of the animal, conducting the trial on such kind of animals will be a very difficult. And in almost nutrition trial or a dietary trial or a feeding trial, the production is very, very difficult in zoo animal nutrition. Whereas in domestic animal model, suppose if you want to conduct a feeding trial or dietary trial, the main two, the samples we need to focus on a urine and the feces and the body weight measurement. So these three criteria are very, very important for any nutrition studies. We have to monitor the body weight regularly. So we don't have the facilities. Many zoos don't have the facility to record the body weight as far as animals are concerned. Second thing is collection of urine and collection of the feces. It's highly difficult. Unless and until you have any designing models to collect the feces and urine, and again we have to capture them also. You have to confine them to the cages also. So that's doesn't sounds good. So that's why sample collection is also one of the biggest challenges in wild animal. As well as as I told earlier also, there is sufficient number of animals in the question area. So for any research, the scientific trials, we require a minimum number of animals. So that most of the zoos are lacking in that area. And as I told you, the sample collection is a bit difficult one. And some animals, to collect the samples itself, we have to go for repeated analytic procedures, which is not feasible also, especially in wild animal nutrition. Overall, I can say that animal nutrition are lacking across India also, what I can say is. Because most of them are focused on surgery, medicine, and some other management. Nobody will focus on nutrition. What I mean is nutrition it's a scientific feeding program. So feeding the animals to the core of nutrient requirement of that particular species. What I mean to say that. So in order to focus on the micronutrition, what do you call the formulation feeding, such kind of things, we require a specialist in such feeding programs, especially in zoos. Another challenge is in zoos. Just you can see the picture also. See, this bird weighs around like 5 to 10 grams to the largest mammal of maybe 4 to 5 grams. So it starts from the smallest body size to be calibrated body size usually. So to formulate a diet for this various different sizes of body sizes of the animal, we should have knowledge on the body size. So that's the one thing. So you have to calculate the diet for this 10-gram bird to this 4.5 tons of elephant sauce. That's the biggest challenge. Overall, I can say that in order to maintain this zoos scientifically, zoo nutrition plays a very, very critical. So zoo nutrition is a critical component of scientific zoo management. So if you are managing the zoo scientifically, means see 50% will be the nutrition, 40% will be the management, and 10% will be taken care by the veterinary. If you take care of the both the good management and a good, the problem is solved. Manage scientific. So zoo nutrition, so better immunity, better health. Once there is a better health, there will be obviously there will be a reproduction that will aid for the successful conservation breed program of the animals and the longevity of the animals also improve. So what is the importance? The zoo nutrition is very important in managing the zoo scientifically. So it covers overall objective of the captive animal management. What I will say. So how to improve how to adopt any feeding strategy. What I can say is one is provide a balanced diet, so that should meet all the micronutrient requirement of the particular species also. Next is provide a diet that stimulates natural feeding behavior. So we in wild they have access to the n number of feeding articles also. Whereas in zoos there will be a stereo monotypic feeding behavior. Say for example, if a tiger it will feed only on a cow feed or a goat feed. That's it. So apart from these three sources, these animals don't have any other choice. So in order to stimulate an actual feeding behavior, sort of course also. So the third one is provide a diet that animal eats consistently. Eating a similar kind of food every day throughout the lifespan, definitely there will be some issues. To stimulate that you should provide a diet, the animal should eat happily and consistently. Make sure that. And provide a diet practical and economical to feed also. So in domestic and always they will focus on a least cost formulation with a proper nutrient requirement and a better performance. So such kind of to run a zoo, the feeding programs are also very important because what I can say is in domestic animal model, 75% of the overall expenditure goes towards feeding. Whereas in Indian zoos, the most of the economical factors is lies with the and 30 to 40% of the sale of the overall revenue is diverted towards the feeding program. So it's quite opposite to the domestic animal model. So this is how there is the importance of wild animal nutrition. If you maintain a proper, very good nutrition for the captive animals, definitely there will be successful conservation very important. So diet formulation. So usually at present in almost all the zoos, the diets are formulated based on the natural diet. So first they will see what these animals are consuming in the natural environment, and same thing can be in zoos also. So because see, if you take the example of lion-tailed macaque, it has a it will have access to 152 types of veg greens in the natural forest. Whereas in captive condition, it's highly difficult, highly impossible to provide this 150 varieties of natural what we call scientific method. Roughly, on an average, we can have access to like 4 to 5 varieties to natural lion method. If it's possible, try to mimic the natural feeding behavior with captive wild animals. The second one is domestic animal model. Most of the times there will be a domestic animal model for the dairy nutrition, canine nutrition, feline nutrition, then the reptile nutrition. Same model can be exotic pet animal nutrition. Same model can be adapted to the wild animals to some extent. And sharing the information between the zoos. So we have a quite a couple number of zoos and there are quite a good number of zoos which are feeding their animals science and they are achieving the goals of conservation trade program successfully also. So in such cases, we can get information from such kind of zoos where there are field programs. Experience of the keepers, of course. So these keepers will be working with the animals like maybe like 30 years, 20 years, 24 years to get the information from them and just pass it on to the others also. And the research work conducted in Western zoos. So what will happen here? See, most of the zoo trials are conducted in Western zoos on these feeding trials. But in Indian conditions, not many studies are there. So here, the field what they are using is commercial field, and you cannot implement them as on the research laws. So the availability of these commercial field is also question. So in Indian scenario, animals are fed on raw ingredients. We are we are fortunate to have a very good raw materials, with a fresh one, and we feed the animals with the fresh raw material. Whereas in Western condition, so the more they are dependent on the commercial foods and frozen foods. So balanced diet is our is to meet the nutritional requirement, which have a requirement of the energy, protein, mineral, and vitamins. So if you meet these what do you call that nutrients in a proper way, that will be called as a balanced diet also. Usually the diet formulation is based on the dry matter content of the body of that particular animal and energy requirement of the body, or energy requirement of the animal. Say for example, the dietary requirement is based on the body weight and sex of the animal. So that's why I told you you should have on the body weight of each and every species to calculate the nutrient requirement also and also formulate a scientific diet chart. So body mass index, height and weights are the basis of human being. Similarly, you can see, so most of the zoos don't have the facility to record the body weight of the animals. So in Mysore Zoo, we are practicing this recording the body weight of the big cats, monthly ones, fortnightly ones, and based on the body weight, just you can see the chart of the tiger's body weight. These are the female, 1 to 4, Manya, Nisha, Tara, Amrita. So the body weight will be from 100 to 127. Whereas in males, it varies from 147 to. So this is the older one. Adults will weigh around 176 and the subadults will weigh up like 147. So based on the body weight of these animals, we can calculate the diet requirement for that particular animal. So in most of this, what will happen if they don't have a record on body weight, even for the is weighing around 97 or so, they feel the same quantity is getting like 127 kgs of animal also. So try to establish a weighing the machines wherever it is possible to record the body weight and based on the body weight is calculate the nutrient requirement also. And recently we got a from Singapore also and we installed this so based on this, we can have a monitor the body weight of each and every animal, and we can calculate the nutrient requirement also. So this one, so this is the basic thing what I can say is physiology, physiology of each and every. So being a vets, we should know that there is a monogamous or a ruminant, whether it is a hindgut fermenter or the foregut fermenter. So if you know the physiology of the gut, then only it's very easy to formulate a synthetic diet chart. In case of ruminants, we focus on three. In turn, these microbes will convert as a microbial biomass, and from this microbial biomass, the protein will be derived to the volatile fatty acids. In turn, these volatile fatty acids will enter the energy cycle and thereby yielding the ATP. Whereas in monogastric, purely there will be energetic degradation. So once the macromolecules will be break down to simpler micromolecules with the help of enzyme, then it will be absorbed by the intestine. So one should have thorough knowledge on gut morphology breaking into a particular animal. So if you know the gut morphology thoroughly, while feeding also you can apply the knowledge practically. So whereas in juvenile animals, stomach also, the development of the rumen also. So when it will be fully capable of digesting the feeding material, up to what age you can feed them the milk and everything. So here the rumen papilla growth of a 6-fold animal, you can see that. So this is the structure of the rumen, which is fed with one level. So when it started taking the milk and feed, to the structure, when it's starting both male feed and fodder, structure will be. So if you have a knowledge on the gut morphology and gut physiology, it's better to you can formulate the diet very beautifully. So this is an example I am showing you. So if you want to formulate a diet based on the dry matter intake of a particular animal, so this is an example. The 2% of the total body weight of animal is dry matter intake. Say for example, here I am taking the of the 150 kg weighing sambar and the dry matter intake to consider the 2% for 150%, 2% dry matter means 3 kg. So again, how to meet this 3 kg dry matter? The roughest to concentrate ratio is 70 to 30. Clean and dry powder is 75 to 20. So roughest, say for example, if you take 2.1 kg, if you feed it 10 kg of wheat powder, you get a 2.1 kg of dry matter from the roughest. If you feed a 1 kg of concentrate, you get a zero point 0.9 kg of dry matter. So totally 10 kg of wheat powder, 1 kg of. So if you formulate such kind of diets, so you will meet the 3 kg dry matter. Similarly, if you want to calculate the diet based on the energy requirement for the mammal species, you have to use this Kleber's equation. So this is Kleber's equation is mainly on the basal metabolic rate of the particular 70 kilocalories into body weight to the power of 0.75. Say for example, a marmoset weighing 128 grams, the BMR is comes to around 15. So the energy requirement will be like 1 to 2 times the BMR. 15 is the BMR, 1.8 times is 27 kilocalories. So 128 gram weighing marmoset requires 27 kilocalories. So you should focus on for that particular marmoset. Based on that, you can use immediate also. As far as the big cats, again the energy requirement is different. Say for example, if the tiger is weighing 130 kg, so energy requirement is around 100 kilocalories per kg body weight. Is an example. So total energy requirement for 130 kg is into 100 kilocalories comes to 13,000 kilocalories. Just imagine 13,000 kilocalories per day per tiger, which is weighing 130 kilocalories. On an average, be an adult weighing around like 60 to 70 kg, he may require 1,800 to 2,000 kilocalories, whereas 130 kg weight requires 30 kg. So we should focus to meet this energy requirement for this particular time. So each kg of beef provides 2,000 kilocalories. To meet 13,000 kilocalories for that tiger, which is weighing 130 kg, we have to feed 6.5 kgs of boneless beef and 9 kg of beef with the bone, considering 60 to 40 meat to bone ratio. So here in one more study is there. See the energy requirement, digestible energy intake of a particular animal. Say for example, the tiger almost lies between 12,000 to 40,000 kilocalories, like 6 to 7 times the requirement of the human being. Similarly, for the carnivores, say 50 kilocalories per kg body weight is the one, because the flying birds require more energy. So here, this is the Indian grey wolf is the carnivores, the lesser carnivore, and the energy requirement is differs. See, it's a 150 kilocalories per kg per day. Whereas in the tiger, energy requirement is 100 kilocalories per kg. That is a big carnivore. Smaller carnivores, on an average, energy requirement is 150 kilocalories per kg body weight. So almost if you feed 2.25 kg of boneless beef or a 3.1 kg of beef with the bone, so you can reach 4,500 kilocalories, which is required by 30 kg plywood. So energy requirement lesser carnivore is entirely differs. So once if you know the energy requirement of that particular animal for, on kg on body weight basis, so in turn you can calculate the total energy requirement and also you can formulate the scientific diet also. And energy requirement for the main in case of birds is the equation 158 kilocalories body weight to the power of 0.75 and 2.8 times of the BMR. Pressure in smaller birds. Non-pressure again this varies. With 158 kilocalories, here the 78 kilocalories. So based on these equations, the help of these equations, so if the body weight of the particular bird, you can calculate the energy requirement very easily. And there is another slide which shows part of the energy for different birds also. And energy requirement for the carnivore birds, almost it is like if the crane weighing around 5 kg body weight, so the energy requirement will be around 550 kilocalories. So based on that, you can calculate the ingredients, you can formulate the diet also. So there is another equation for different types of birds also. As far as the protein needs for egg production, see here, the birds that lay only few eggs have an protein requirement of about twice the maintenance for a peak duration. Say, for example, exotic birds like a macaw, they will lay only 2 to 3 eggs. So during breeding season, you should concentrate on the protein requirement and you should double the requirement of protein during the egg laying period. Whereas birds that lay many eggs are require up to 6 times the maintenance of the energy, sorry, the protein, like a critical amino acids such as a methionine and lysine. If the birds laying a few eggs requires twice the protein requirement, and if the birds laying more number of eggs are required 6 times more the protein requirement. In the wild, what will happen? Many birds increase their intake of invertebrate during the reproduction, like worms, the invertebrate worm. A phenomena known as a protein shift. Whenever there is a laying starts, these wild birds will prey on and feed on these young number of invertebrates to meet the protein requirement during that period. The requirement for is dependent on the number of egg laid. See, if the birds that lays 1 or 2 eggs can replace the bone reserves, we need not to supplement the calcium also. If the birds laying in a clutches like 6 to 7, 8, 6 to 15 eggs, or 7 to 15 eggs, so increase the calcium required in the diet and how to supplement the calcium. So based on the requirement of energy, that is using the energy requirement or the dietary intake, we should calculate the nutrient requirement. After knowing the nutrient, after calculating the nutrient requirement for that particular species, you can formulate a diet based on the availability of the local what do you call it, feeding materials in your area. Say, for example, this is the diet chart of the slug bear. Nutrient requirement, we have formulated the diet using the available local ingredients, and also to some extent we are mimicking natural behaviors like giving the honey and the sweet potatoes also. So some other diet charts which were adopted in my group. And next thing is once if you know the importance of wild animal nutrition and the nutrient requirement of the animals, and the next thing is the procurement of the raw materials to formulate a diet. See, purchasing food quality food at any price is bad nutritional management and bad economics. If you know the requirement of the nutrient, if you know the body weight of that particular animal, so you are calculating this nutrient requirement. So with the poor ingredient, you cannot meet the requirement of the nutrient in a proper way. Though you have a very good knowledge on the nutrient requirement and all those things, if you don't procure the good quality procurement, again your chain will break and that is not going to serve the purpose of. So here, so these are the food ingredients like beef, non-vegetarian, and the aqua products like fish, prawn, the chicken, rabbits, and the grasses, food grains, and miscellaneous items. See, how to evaluate how to control the quality of these particular nutrients. See, the maize almost the 25% of the world grain maize production is contaminated with the modes, that's mycotoxins. Again, these mycotoxins are the hidden. If you feed a poor quality maize to the animal, definitely in the chronic it will affect the kidney also, end up with renal failure or a liver problem. So you should for the fungal infection or a fungal infestation, especially in maize. And the water content of all the what do you call that, the grains, say for example, the permissible level of water content in almost all the grains is 10%. So if the water content of that particular grain is more mean, so indirectly the grains will have a affinity towards the what do you call that, mold infestation also. So that is the one thing. And again, if moisture content is more means you are paying money for the water content, not for the nutrient content. Again, even if you calculate the proper quantity of grains also, the ultimate the nutrient content formulation will not meet the requirement of the species also. So you have to check for the water content and the time of harvest. If it is the immature grains, again the nutrient level will come down. Again, there will be three grades of food. You can see the grains: food grade grain, feed grade grain, and poultry grade. Food grade goes for human consumption. Feed grade goes for the dairy industry, and poultry grade again it will goes for the chicken industry. So you should have a knowledge on the grade of grain and better to procure at least the food grade and feed grade for the formulation. So same thing. So for all these grains, we need to search for the adulterates, whether these what do you call it, the grains will adulterate with the husk, the sand material. Have to look for that. Again, the fodder, the time of harvest is very very important, especially in case of the fodder. And here you have to check for moisture content. See, anywhere between 25 to 10 to 25% of the moisture percent is acceptable in hay grass. If it is more than that, again there will be economic loss for that. Simply we are paying money for the water content rather than the climate. You have to check for that also. Again, the fruits and vegetables. So you have to check for the pest fruits and vegetables. That is the most important thing because there is no availability of data is there on a susceptibility. We don't know whether which species is highly specific to the pesticide. If you don't have a check on the pesticide content, so you cannot avoid the pesticides. The best way you can wash the vegetables and the fruits and vegetables thoroughly with tap water and make sure that after washing only it will be captured in the animal. So thorough washing is the only solution, especially for the fruits and vegetables. And next is commonly available meat sources, that is beef, lamb and goat, chicken, fish, prawns, and the likely like a rabbit, chicken, rats, mice, meatball, super, rat snakes, and grasshoppers. These are the non-vegetarian section, especially the meat. So because make sure that here raw beef. So if the infected carcass, there will be microbial load. Directly we are putting the microbes to the animal. Make sure that the meat should be devoid of the infection. Like accept the carcass along with the heart, liver, and kidney attached wherever it is. So if he brings the if the supplier brings the packer, at least you can observe the grass pathology, the grass changes in the heart, liver, and kidney. Definitely, the animal is died due to any septicemia or any disease condition. You can see the lesions in the heart, liver, and kidney. So make sure that the carcass will come along with the heart, liver, and kidney attached. So just see the organs and you can pass the quality of the carcass also. And check for the meat to bone ratio, whether it is emaciated, and check parasites and the nodules, and check for the temperature of the carcass also, whether it's fresh meat, stored meat, stale meat, and of course the microbial load. So, and one more thing is you have to see is like the mammary gland. See, most of the time the carcass will come with the mammary gland. Not advisable to feed this animal because we don't know whether the animal is suffering from the mastitis. If the animal is suffering from the mastitis, it's a what do you call it? It acts as a very good media for the microbial growth, and there will be the presence of microbes also. If you feed such kind of a mammary glands to the animal, again the possibility of infection is more. So stale meat you have to reject at any time without compromising and the fresh one. And next is procurement of the fish. See, as far as procurement of the fish is concerned, we have a smaller birds and the bigger birds. So to suit the body size or the size of the fish, we should procure the mini fishes like a 2 inches, 4 inches, and the 6 inches fishes based on the body weight of the animal. And fishes are highly rich in protein because 45 to 50, it has a 45 to 50% of the protein content, and it acts as a very good and it acts as a congenial environment for the growth of microbes. So salmonella infection is the first thing. So we should check for the quality by observing the gills. So if it is a bad quality, we should reject it. So the farms again this prawns is a highly, what do you call that, costliest raw material among the animal feeding in a zoo nutrition. So this prawns will cost you around like 600 to 700 rupees. Most of the times it will be adulterated with the smaller fishes, dried fishes. So which is like 120 rupees to 130 rupees. This is 700 to 750 rupees. So just have a check, and if you find more this kind of what do you call that, small fishes, dried fishes, you have to compromise for the quality of the prawns. And the poultry, so we used to rear a day-old chicks in our zoo, and thorough health monitoring will be in place. And once make sure that the chicks are healthy, then we will feed them. And the rabbit also, we have a rabbit rearing unit, and this is how the to evaluate the quality of the different feeding units of the procurement also. So next is feeding schedule and diet practice at zoo. The carnivore, so there will be a one time a day, that's a evening we feed the tigers, and most of the times these tigers are suffer from deficiency disorders, uh, especially the big cats like Asiatic lions, hunting cheetah, and boneless meat supplement with the calcium. If you are feeding boneless meat with the calcium, and try to have some behavior enrichment also. And in summer, you can reduce the feed, and in winter, you can increase the quantity of the feed for the mega carnivore. So this is the diet requirement like 9.5 kilos, 8.5, for leopard 4.3, for a tiger it is 10.5, and small carnivores, the meat required is for jackal is 2, wolf 3.2, goat 2.25, fox is a half kg, and smaller cats like jungle cat, leopard cat is almost 300 gram to 500 gram. And for the birds, so based on the body weight, so this is the what, so that we have shown in the diet chart also. And is for the crocodiles, so we feed them on both the meat and the fish, only on the fish. And for the turtles and tortoise also, and for the snakes, so these rats, mice, and pigs will be fed once in a week. And for the monitor lizard, the 250 gram of chicken. So that's regarding the feeding schedule and the diet chart. And the feeding schedule different. Two times of feeding, concentrate in the morning, and fodder almost throughout the day. So based on the body weight, so the calculation of the feed requirement is based on the body weight, especially in elephants. That is the 5% of the body weight is the requirement of the feed. Say for example, this weighs around 5 tons. So sorry, 4 tons. 5% means it's 200 kg of feed. And ensure feed for all. See, if you have a pack of wood like a 10 to 12, so feeding is very difficult. You cannot feed them individually. If you have feed them individually, you can take care of the quantity. When you feed them in a pack, it's very difficult to feed to have equal chances to all the foods. So ensure feed for all. You should adapt feeding strategy also, and feeding the wound to elicit a natural desire. If you are telling the beef to the strength to the man, so there is someone here and there here. So that's how you can increase this to elicit the natural feeding behavior also. And in some countries, they have adopted the carcass feeding program because in field condition, you know that the tigers time like a 50 kg at a time, and they will rest for another 7 to 10 days. Again, they will go for a hunt. So if you want to concentrate such kind of things, carcass feeding, a once a week feeding is also can be adopted. So if you feed 10 days, so make sure that you feed the tiger up to 10 days, and there will be a break for 1 day fasting. Whereas in lesser carnivore, so the fasting is not mandatory. So in most of the zoos they will follow, but in Indian condition, so it's very difficult to follow that also. So insectivore nutrition. So here we rear mainly the mealworm and superworm in Mysore Zoo, and per year we are harvesting around zero point 0.5 tons of 500 kgs of and on a shift basis, weekly 3 days, we feed these the primates and the baboons and the birds and all small carnivores which require the insect to make sure that insecure nutrition insects are a very good source of protein. So in most of the videos we can see that this subspecific so you can see that the all kinds of food are really again the birds also with this insects. So even the Saras cranes, you cannot imagine the so in a 10 day itself it will attain the height of like a 2 feet. So it requires a lot of protein. See here, so this Saras crane is fed with grasshopper and how beautifully this mother is feeding the baby with the grasshopper. And the final one is how to evaluate the feeding practices. If you know everything and you formulate everything there, and you have to see the end user also. So the thing is the wastage, quality and quantity, the body condition scoring, infant mortality, and successful breeding. So based on these criteria, you can evaluate the feeding practices, whether the feeding practices is good or not. The body condition scoring of the animals, especially and people scoring, the consistency, smell, and color of the feces will indicate the health of the gut. If your gut health is good, means definitely your health is also, the overall health of the animal is also good. So if you have a very good feeding program, definitely there will be very good conservation breeding program, successful conservation breeding programs. This is all. So the role of different stakeholders in scientific feeding of captive wild animals and zoo is starts with the veterinarians. He has to have a thorough knowledge on the physiology, gut physiology of that particular animal, nutrition requirement of the particular animal, and he has to prepare diet chart, scientific diet chart, and he should have a knowledge and quality evaluation of raw material. The head of the institution, the procurement of the quality raw materials. Even though veterinarians are having a knowledge on nutrition, if the quality of the raw material is poor, the whole program will be a failure. And the in charge of store officer, the quantity check, he should receive the proper quantity, and the processing and storage again, don't have a proper storage facility, again will be a failure. People should ensure the quality and quantity at the enclosure level, acceptability and wastage, individual, of course, the animal. Animal, it will reflect from the animal performance, breeding, and longevity of the animal. So, all these are the stakeholders for the successful and the breeding program of the captive wild animals. One is life stage. So apart from all these basic things, so there is a different nutrient requirement at the different life stages of the animal. So there is a juvenile nutrition, so nutrition for the growth, nutrition for the maintenance, nutrition for the production, nutrition for the pregnancy, nutrition for the lactation. There will be clinical nutrition, geriatric nutrition, and other some components also. So just we'll go quickly through these stages also. Hand rearing, there is a poor mother instinct from the mother. To the lack of privacy, anyone should have exposure to that. See, what will happen? If the mother is rejected, we have to separate, we have to separate and we have to go to the nursing room and we have to hand raise them. That's the one thing. So there is no alternative, there is no replacement for the mother's milk. Make sure that it should not be separated. The baby should not be separated just because the mother is not nursing during 3 hours or even a day. Wait for a day, wait for some other hours also for 3 hours. And once you are pakka that the mother is not taking care there, then separate the baby and you just concentrate on the juvenile rearing or pediatric care. So sometimes the mothers will reject and they don't have the instinct to instruct the baby. So we'll bring it to the zoo hospital and we will handle them to the zoo hospital. Second thing is again rejected by the mother and there will be carrying mother. Most of the time So the mother will deliver. Keep the pox out. If such kind of behavior is there in a mother, immediately you separate the babies and brought to the zoo hospital. Here, the baby, we separated the babies because we noticed the cannibalism behavior and we brought the babies, and these babies are nursed with a, what do you call that, surrogate mother. We identified the mother, the pug, which lost their puppies also, and it has taken care of these puppies very well. And after 1 month, we brought them to the zoo hospital, and by the time they are in the meat also, and they are 22 days. So whenever they are rejected by the mothers, or whenever you notice the cannibalism, in such cases you can bring the animals to the zoo hospital and nursing center, and you can handle them. For that, you have a knowledge on human nutrition also. So whenever there is a sick animal, say this suspected capuchin carrying a 1 month old capuchin baby, so we suspected that the mother is carrying the uh, baby on the back. So we suspect there is something, and we observed the binoculars also, and we separated and we bring to the zoo hospital. So we suspected for any something like pneumonia or a respiratory illness, and we brought to the zoo hospital and we kept the that baby in a incubator, baby incubator, and we take care of them, and it's doing good also. So sometimes, see, we witnessed a birth of elephant calf that is a park at Mysore Zoo, and the body weight is very, very fantastic, like 110 to 120 grams. They old body weight of the elephant calf. In spite of that, also because of weakness, we don't know exactly. So she was not able to get up on her own. So what we did, we separated the baby calf and we assisted for 1 or 2 days with the formulated milk formulation by our vets, and we fed her for 1 or 2 days. And once she started gaining and she stood up on the legs, and we allowed her to the mother, and she has taken care. This comes under juvenile nutrition, pediatric care. So second thing is whenever there is a we take the rescue crop, we have expertise in rearing almost all the juvenile species in Mysore Zoo also. So dove, tardy cat, greywood, arena, and even the nursing of the birds. So whenever you are talking of juvenile nutrition, you should know the nursing. Training the neonates to suckle the milk from the bottle is hard because so when the baby is not suckle the milk from the mother teeth, she don't know how to suckle also. And selecting a proper nipple and the whole size is also very very important. See the nipple size. You should search the proper nipple size for a particular species. And whole size of the particular nipple is also very important. Otherwise, again, it will end up with an aspirate pneumonia. That's the one thing, nursing technique. Choosing the right formula, milk replaces the best milk replacers should be fed with babies. And the clinical problems, whenever you are hand rearing, there is a most common one is diarrhea. Withdraw a formal milk, maintain on a and increase the formula slowly whenever the baby is recovered from a gastrointestinal disorder. The practical tips is sterile recommendations. So feed the babies when the baby is in sterile recommendations. Just observe how these babies will suckle milk from a mother. Same position you have to maintain. Avoid suckling the hair and stimulation to when the baby is the mother, definitely she will lick the urinary genital organ and also the anal region. So thereby making the baby to urinate and defecate. So whenever you are hand raising, you make sure that you stimulate the urinary tract, the genital tract, and also the anal region to make the animals to pass the feces also. And the quantity and frequency of feeding, it's mainly based on the body mass, the gut capacity. How much to feed, it depends mainly on the gut capacity of that particular species. A baby which is weighing 20 gram or 30 gram, then we have to decide what is the quantity of the milk you have to provide and what is the frequency you have to maintain. In the table, it's like a bulk of the 15% of the body weight, and for the herbivores, like the ants, mammals, 10%, canines and felines, 14% of the body weight, and bears, 3% of the body weight is the common of the beef or particular. So sometimes what will happen, see, whenever you say conservation period breeding program, so most of the times, so den has to be provided in an enclosure in a natural way to provide a privacy to the animal to breed. So here we have witnessed a breeding I-9 case because of heavy rain. It was flooded with rain, and it demands and it necessitates to separate the babies from the den. And we brought to the zoo hospital, and we trained them to suckle the milk from the bottle also. But unfortunately, so it was end up with the respiratory pneumonia. So here you can see that this puppy is lying here, and so we noticed there is some problem with the baby, and we brought to the zoo hospital. We took a X-ray, and you can see the bleeding in the lungs, and we suspect for the aspirated pneumonia because of faulty nursing technique. Maybe sometimes it will happen. And she was given a continuous. She was she was given a continuous inhalant therapy and a course of antibiotic therapy, and she recovered, and she is doing well also. So why I'm showing these slides means whenever you're feeding a baby, the feeding in a right way is very, very important. Selection of nipple size, and position, and the quantity and the frequency. So these four criteria we need to maintain. Another one which should not be neglected is hygiene. So life stage nutrition again in the pregnancy and lactating pregnant feed 25% more than a normal feed to the animals in a 2 to 3 times, and lactating mother also supplementary feeding has to be done. Fasting is not required in pregnancy, and geriatric nutrition make sure that see, usually because of the hierarchy in a group, so these geriatric animals won't get a equal chance to feed because of the dominance hierarchy. These animals feeding water farms to minimize the social dominance in the herds, especially in the older animals. See whether there is based on the dentition of the animals, you can choose for the boneless meat, soup, and such kind of things for the geriatric patients. And it is for the clinical nutrition for the sick animals. Go for the liquid diet, soup, change of diet, different variety of feed or meat. Force feeding sometimes you have to feed a some intimate animals and have to feed them, or you can assist them in feeding also. So most of the times they will benefit suffer with the deficiency disorders, iron and calcium, especially big cats. Whenever we are feeding animals in a group, make sure that feed for all, feed them in a different forms, make sure that all animals have a equal chances for feeding. Whenever you feed a mixed species, whenever you feed a zebra along with the ostrich and emus, mixed species feeding, again the feeding is a challenge. You have to take care of all those things. And the seasonal shift, the winter nutrition and summer nutrition, and protein you have to take care. Diet transition, whenever we acquire some animals, so there will be diet transitions will be there. We have to adjust slowly, the animals should adjust slowly to their the previous feeding diet chart. You have to take care this one whenever you are planning for acquiring a new animals to be those diet transitions should be followed. And summer nutrition, you have to make them animals should be given the fruits embedded with oils and the coconut coconuts for the chimpanzees. And most of the classical problems in captive feeding is carnivore, red meat feeding, it's a calcium deficiency. Primates, again a calcium. Fish eaters, the calcium. Herbivore, acidosis, vitamin E and calcium deficiency. The regular supplementation of with the species specific micronutrients will take care of the above said problems to a greater extent. For almost all the species specific supplements are available. So just concentrate species again. I'm stressing. most of the times what will happen, they'll feed canine supplements to the herbivore supplement to the canines. Don't mix that. So constant there is a species different supplements in the market. Just looking and feed for the particular species. And even we have uh, the reference materials from the season like standardization of animal diets in Indian zoos. We can refer this. And there is a AZA nutrition advisory group and nutrition advisory group for Western chapter. There are plenty of references are there like wildlife feeding and nutrition by Robbins, nutrient requirement of non-human primates by NRC. So you can refer more number of literature wherever it is available and try to implement the same based on the body weight. Have a body weight, calculate the climate intake, energetic requirement, procure the locally available raw material place. So based on the local raw material, we can formulate a diet and it should be accepted by the animal and the animal should perform better and it should be a least not formulation also to take care of the economics of the human management also. So in conclusion, I can say that conduct more biological trials in captive humans to generate a data for the future. And zoo nutritionists have to be employed. I impart training to the existing vets on the zoo nutrition and educate them to evaluate the quality of the foodstuffs and raw materials which we procure for the feeding and to have a slaughterhouse for large animals and food premises that they eat. Better to have in-house slaughter facilities for farmer, educate keepers on a diet management, adopting best models of the zoo diet formulation from other zoos. Species-specific supplementation should be practiced effectively. So thereby, to some extent, we can help the zoo with the scientific feeding programs. That's all. If any doubts, I can take up the questions also. Thanks, Sam. What is next?
Ah, Thank you, sir. Sir, we have a question for you. So, first question is: a male python has got adopted to live chicken due to the continuous long practice, and he is refusing to take frogs now. So, how can I make him feed on frogs?
Sorry, once again.
Sir, Sir, there has been a male python that has got adopted to the live chicken due to a long practice. Now they want to feed this python the frogs, but it is refusing to take it. So how are they supposed to do it?
It's a very critical question. What I can say is I can share my experience like even we have anacondas and anacondas are feeding on a like a day old or a week old and we try to feed them with the rabbits and the rats and also frogs also. I don't know exactly, but so I don't know exactly because frankly speaking, I don't know how to make it. But moreover, the reptiles will adjust it to the prey, which is have access to the earlier, what I can say that. But I don't know exactly. You have to search for that. Next, yeah.
Yes, sir. The next question is, if I offer bread to civet cats, should it be baked or not? Is there any adverse effect of bicarb on them?
Definitely try to avoid the bread items because it's not a natural diet. So if you are really following the bread, so usually in almost all the zoos, breads are already baked and it will be covered. So better to procure commercially available breads which are packed. Okay, one thing. No need to they cook. And my advice is it is not a natural diet. So we drop and switch over to the natural diet. Next.
So next question is how to offer liquid medications through beef in case of leopards.
What we are following, if it is a, say for example, deworming, It's a liquid medicine. Liquid dewormers are also there. We used to inject the meat chunks, the boneless meat chunks, and those chunks will be offered to the leopard. That's how we are following in our zoo.
So next question is, please throw some light on feeding frequency and fasting interval for captive wild animals.
Captive wild animals, like which species? Is it specific?
No, sir, they have not specified, but on general, the feeding frequency and fasting interval.
See, for herbivores, it's wise to follow a three feedings like a morning and at the evening. It's whatever may be the thing, just practice the split feeding. Split feeding is always a better. The morning, afternoon, and the evening. Whereas in carnivores, usually a one day feeding is practiced. Whereas in birds, two times feeding. Once in 10 days feeding practice. So especially hind-gut fermenters with a large intestine, with a large stomach, something like zebras and what do you call that? Again the rhinos, hind-gut fermenters. The split feeding is practiced and is better to have split feeding because they are more prone for a colic. So that's why the frequency of feeding should be number of frequency of feeding should be more than 8. It's always better.
Uh, that's it, sir. Thank you so much, sir. In this, with your busy schedule, also you made some time and delivered a presentation on a request. Thank you so much, sir. And this was a very insightful presentation. In case any of our viewers have more questions, we'll ask them to reply on the chat live, and we would get back to you, sir, for on those questions. Thank you so much, sir.
Okay.
So our next talk would be by Dr. Manjunath, scientist of IAH and VB, Bengaluru Bannerghatta Biological Park. So he would be delivering his talks on zoo animal postmortems. Over to you, sir.
Good afternoon, madam.
Good afternoon, sir.
I'm uploading the PPT.
Yes, sir. Yes, sir. Sir, and please enable your video also, sir.
1 minute, madam.
Yes, sir. Yes, sir.
Hi, madam.
Sir, your audio and video is good, sir, but presentation we are not able to see, sir.
Yeah, I cannot upload here. So is this a uploads? It's showing screen and application.
Sir, go to application, choose application, sir.
Yeah, we can't display your share document. Wait, madam, I'll log in one more time.
Yeah, sure, sir, sure, sir.
Is it visible, madam?
Yes, sir, now your presentation is visible, sir. Sir, can you hear me, sir?
Shall I start, madam?
Yes, sir, sir, please start, sir.
Some problem, madam. Moving side.
Uh, Sir, maybe it's because of the network issue, like even your video is getting blurred. Maybe because of the network issue, you're not able to go forward, sir.
Yes,
Now,
ma'am.
yes, sir, now it's working, sir.
Yes, ma'am. Shall I start, ma'am?
Sir, yes, sir, you can start, sir. Please start, sir.
respected Member Secretary, sir, Executive Director, Mysore Zoo, and Dr. Ramesh, sir. Good afternoon, everybody, and also my seniors and colleagues. Today, I'm explaining the webinar on postmortem procedure for postmortem procedures for wildlife veterinarians, and particularly the veterological implications. So first we discuss or know what is the definition of postmortem examination. So postmortem examination is a systematic and scientific examination of dead body to ascertain the cause of death. So here we use two terms in postmortem examination. So one thing is autopsy and necropsy. So autopsy usually used in the human medicine, and necropsy is commonly used in veterinary medicine. So the person who conduct postmortem is called autopsist. So we'll come to types of postmortem examinations. In veterinary medicine, there are three major types of postmortem examination. One is complete postmortem examination, and second one is incomplete postmortem examination, where in some cases we should not open entire carcasses and need not to be open the entire carcasses. For example, rabies. So third one is cosmetic postmortem examination, are also called needle
Sir?
necropsy.
Sir, just a second. Your PPT is not visible, sir.
What about now, madam?
No, sir. Only it's been shared to me, but not. I can't see it on the YouTube, sir.
Okay.
Sir, can you please close your PPT once and again start sharing the content, sir?
Sure, madam.
Yes, sir.
ಅಂದ್ರೆ ಡಾಕ್ಟರ್ ಫೋನ್ ಮಾಡಿದ್ರ ಸರ್ಟಿಫಿಕೇಟ್ ಏನೋ ಬರ್ತಾ ಇಲ್ಲ ಮಾಡ್ಲಿಕ್ಕೆ ಹೇಳಿದ್ರು ಮೇಡಮ್.
ಓಕೆ ಓಕೆ ಓಕೆ
ಅದಕ್ಕೆ ಮಾಡ್ತಾ ಇದ್ದಲ್ಲ ಅದಕ್ಕೆ ಶ್ರೀಶೈಲ ಆಯ್ತಾ
ಇಲ್ಲ ಇಲ್ಲ
ಮೈಸೂರು
ಹಾಂ
ಅಲ್ಲ ಅದೇ ಮಾಡ್ತಾ ಇದ್ದಲ್ಲ ನೆಟ್ವರ್ಕ್ ಓಕೆ. ಅಲ್ಲ ಅಲ್ಲಿ ಬರ್ತಾ ಇದೆಯಾ? ಅದೇ ಟ್ರೈ ಮಾಡ್ತಾ ಇದ್ದೆ ನಾನು.
ಸರ್ ಬರ್ತಾ ಇಲ್ಲ ಆಕ್ಚುಲಿ ಇಲ್ಲ ಇದು ಸಿಸ್ಟಮ್
Yes, sir. We can see you, and your presentation is also visible, and your voice is also clear, sir. So you can go with your presentation, sir.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್.
Yes, sir. We can see you, and your presentation is also visible, and your voice is also clear, sir. So you can go with your presentation, sir.
Sorry for the technical disturbances, sir. And we'll start presentation and postmortem examination.
Yes, sir. We can see you.
Next slide, ma'am.
So just a second, sir. Yes, sir.
Yeah, here types of postmortem examinations. So we know the veterinary science. So we use usually three kinds of.
Sir, could you please keep another screen or phone away because we can hear voices that have been repeating. So.
Yes, ma'am.
Yes, sir. Please, sir. Now you can start, sir.
Yeah, here in veterinary there are three types of postmortem examinations. One is complete postmortem examination, and second one is an incomplete postmortem examination where the entire body is not able to open or need not to be open. For example, rabies or any infectious cases. And third one is a cosmetic postmortem examination, so also called a needle necropsy. So where the VVIP pets are some highly infectious cases. So here we will use a needle necropsy technique. In medical terminology, there are 5 kinds of postmortem examination. One is forensic postmortem examination, and a complete hospital postmortem examination, and limited hospital postmortem examination, minimally invasive autopsy, and postmortem biopsies. Next. Here, why one should perform a postmortem examination. So here, first we should know, so why should we perform postmortem examination? So the first thing is to identify the disease, and also so indicate the appropriate treatment for the disease in the herd, and limit the future losses, and also improve the understanding of the disease effects and also pathogenesis of the disease on the animal, and enhance the discussion of health maintenance programs, so with the animal health specialists. And also it is very important, so of the postmortem reports, so it's also required during the outbreak of the diseases, for the vaccination programs, and for the insured animals, that is death certificate is required, and also government farm animals, and especially the wild animals in the zoo, and also all the wild animals, so they require postmortem examination. Also the experimental animals, and especially veterolarygal cases, the postmortem examination is very important, and we will discuss in detail about this veterolarygal postmortem examination later on. Here, sequence of postmortem changes. See, somatic death is the once the body died as a whole. It's called a somatic death. Once the animal died. So first sequence of postmortem change is algar mortis. That is pulling of the body. The second stage is so rigor mortis. So here, what happened? The availability of ATP is exhausted. So later on, the muscle become contracted. So this is called a rigor mortis. This rigor mortis it depends on the temperature and also the various activities of the exercise, and also the poisoning cases. It varies and it fastens, and also in case of a tetanus, so the rigor mortis is very fast, and it depends on 1 to 8 hours. It start appears in 1 to 8 hours and after death, and it disappears from 20 to 30 hours after the death. And third one is a rigor mortis. So it is also called as a hypostatic congestion due to a gravity, the accumulation of the blood in the vessels of the organs that are found on the lower side of the animal body. So another postmortem clot and imbibition of the hemoglobin, where so after some time these the RBC ruptures and hemoglobin is imbibed into the endothelium of the larger vessels, usually the aorta and thoracic aorta. So in such vessels, and you find in some late postmortems, and also imbibition of the bile, so yellowish pigmentation of the tissues surrounding the gallbladder. Next, and postmortem softening. Here, due to action of the autolytic enzymes in the cells, and also the proteolytic changes from the saprophytes as well as the bacteria in the body, this postmortem softening happens. And postmortem discoloration, that is blackening or greenish discoloration of the organs. So that is due to formation of the iron sulfide. And next one is PM distension, because as you know, the animal dies, so the intestinal bacteria, the anaerobic bacteria, they start producing the gases, and the animal can't able to belch it out and expel the gases. In such cases, there is a distension of the abdomen. And PM desquamation. So after some time, so peeling of the mucous membranes of the hollow organs, it is called a PM desquamation. And displacement, PM displacement, when the carcasses is dragged or rolled. So in such cases, there will be some displacement of the organs. And finally, the PM rupture in advanced autolytic or in advanced autolysis. So the PM, the organs will be ruptured. Next. So in some cases where the postmortem should not be performed, so that is example the anthrax cases. So in such, if you suspect any anthrax case, first you take the jugular blood smear or blood smear from the ear veins in case of the herbivores, and if in case of the equines and porcines, the edematous fluid from the throat or abdominal region can be collected, and you look into and you go for the rapid staining, methylene blue staining, within 1 or 2 minutes, and you can find smears, organisms in the smears. And here, so I try to explain so how to differentiate the anthrax bacilli from the anthracoids. So it is a very tricky and it's a very important topic in the field for the field veterinarians, especially here. It is a very easy technique and easy to perform the staining. It can be done in the field itself. So the capsule staining, the capsule in anthrax bacilli, it is predominantly pinkish stain and less predominant pinkish in anthracoids, and spores absent in the anthrax bacilli, and the spores are present in anthracoids, and length of the chains. So usually the 2 to 3 organisms in anthrax bacilli, and very long chains in case of anthracoids, and also ends of the bacilli truncated in case of anthrax bacilli, and rounded in case of anthracoids. So because no necropsy should be performed in anthrax because these spores survive as long as many years in the soil. To avoid it, and it is better to burn the carcasses, or it should be properly deep burial can be done. Next ma'am. So for the efficient postmortem examination of wild animals, and we need to have a sophisticated facility to conduct a postmortem examination. So one is first one is a postmortem facility. So it can be postmortem room, and the postmortem technique. One should know the postmortem technique and thorough knowledge about the postmortem technique, and also health aspects should be taken while doing the postmortem, and also biosafety measures can be taken because the animal, it could be very animal parts or the organs, or it could be very infectious during the postmortem examination, and support, and also the supportive diagnostic methods before or after doing the postmortem examination. So this work should be conducted in a manner that to minimize the accidents and also comply with the environmental, health and safety laws and regulations. Next ma'am. Here the sequence of putting PPE kit and removing the PPE kit. During putting the PPE kit, first you wear the gown. Then next step is wearing the mask, and third one is a protective eyewear and the face shield, and finally you wear the hand gloves. So while removing the PPE kit, first you remove the hand gloves and remove the protective eyewear and the face shield and remove the gloves. Finally you remove the mask. So this is the steps to putting PPE and removing the PPE. And here one more picture right side I have mentioned. So how to remove the hand gloves after performing the postmortem examination. Okay, the first step is just to pull out the one gloves from inside to outside. Then after pulling out, so one this one, and using two fingers and remove from inner side, you remove the you pull it up and remove the second hand gloves. Next ma'am. And transportation of the animals and the samples is also very important for the postmortem examination. Usually, sometimes postmortem examination will be conducted in the field, in the field itself, and sometimes in zoo, and in these cases, and we transport the animals to the postmortem room and will conduct the postmortem. In such cases, some of the precautions should be taken to transport the animals and also the material and also samples after postmortem examination. So the animal should be necropsized, will be double bagged and transported, so to avoid the spread of infection. And second one is large animal wrapped or covered as much as practicals. And third one is the transport cart should be left outside and at the entrance of the PM room. And so once you perform and you complete the postmortem examination, and the blood samples or any exudates samples and the bottles must be disinfected and removed from the necropsy room. Next ma'am. And some of the points to be remembered while doing the postmortem examination, these are very important. First, confirmation of the death prior to the postmortem examination, especially in the reptiles. So reptiles, because reptiles normally the movements are very low. So even though sometimes in majority of the cases, so especially the tortoise and snakes, and in some of the crocodiles, these kind of reptiles. So first you confirm the death before going to postmortem. Next, should not perform postmortem if you confirm that animal died because of the anthrax. Next ma'am. And the postmortem should be conducted the sufficient daylight. So night time, so or if the sunlight is not proper and this postmortem not advisable to conduct, and Third one is written consent from a competent authority is must. Either it should be police department or forest department, and recording details of an animal identification. So that should be match the requisition and the animal. And also postmortem should not be conducted and carcasses are completely putrefied, and liquefaction of the organs. Next ma'am. Postmortem should be done only when the carcass is presented as a whole body. So if the parts of the body are presented for the postmortem examination, you can give only the report, but you can't conduct the postmortem examination and you can't tell the cause of death. So the carcass should be presented in its actual site, so as mentioned in the letter from the competent authority. So and also in case where so some endangered animal species are scheduled or endangered animal species, the due consent from the competent authority should be must before conducting the postmortem examination. Next one. And also the postmortem area should be very clean and chances of environmental contamination should be minimal while during the postmortem. So all the natural orifices should be closed with a towel or cotton wool, whatever possible, and before removing the carcass and transportation to the postmortem room. So and also handlers should wear the protective coverings while doing these kinds of operations. And also the duty of the veterinary, it is very much essential, and it is very much very essential here, the role of the veterinarian. So you should a veterinarian to ensure the proper disposal of the carcasses. Either it could be a deep burial or incineration or rendering, whatever it is advisable. Next. And also, so while doing postmortem, it is better to have a pathological laboratory nearby postmortem room. So because before some of the diseases, as I said that in some of the anthrax cases and some other diseases, postmortem examination should not be performed. In such cases, so to know the disease, so the rapid staining can be performed before postmortem examination within 5-10 minutes. In such cases, a pathological laboratory facility nearby the postmortem examination is very, very much essential. Next, ma'am. So here we come to the forensic necropsy of wild animals. See, postmortem examination of the wild animals for a legal purposes has becoming increasing nowadays, and the special procedures are necessary during such necropsy to ensure that the information collected is suitable for use in the court of law. So forensic necropsy should be performed by the veterinary pathologist with a formal training and experience, because these credentials will be examined if a case reaches the court. So there must be a strict attention to maintain the chain of custody. That is, so when the some animal, if comes to you, so you should clearly clarified, and you should have a thorough knowledge about so from where the animal is coming, and the letter is given the identify marks mentioned in the letter, and also the identify marks in that animal is matching or not. This is very important before conducting the postmortem necropsy postmortem examination. Next, ma'am. And also a complete record must be kept of all procedures and observations, and necropsy report must be in detail and it is clear, and also it should be written in non-technical languages. So photography should be used as a preservative visual evidence, and also special precautions are required for collecting specimens such as bullets and suspected toxins, and also material for the DNA analysis. Next, ma'am. So here, so very important is in wild animals, we get a call. So for the postmortem examination, and if you see the animal, so animal might have died in few days back. So to know exact date of death, so it is very important to know the forensic entomology, because these flies or insects helps us to helps us to know the so exact time of death. Here there are two types where we can find the data time of death. One is using successional waves of the insects, Another is using maggot age and development of these maggots. And here, first group of flies which are attracts to the carcasses are Calliphoridae flies. Those are called blow flies, green, also called a green bots. And second kind of flies are sarcophaga flies, are also called as flesh flies. These two flies, they attract the carcass initially. So as soon as the animal dies, so when the cells are start dying, so they secrete some of the chemicals. These chemicals attracted by these flies. So these flies, they comes within 24 hours of the death, and they'll lay the eggs on the carcasses, especially the orifices of the carcasses. And second line of flies are Pyophilidae or cheesy skippers will be the second stages of the flies. And especially the sarcophaga, the life cycle of the sarcophaga, it takes approximately 23 days. And if we collect any flies on the carcasses which have died long back, and you study this the life cycle of the sarcophaga flies, and you can identify the carcasses which died. Way back. It died last 23 days. But if the animal is died even 23 days back, within a 1 month, and we can identify the exact date of death. Next one. See the blowflies life cycle. See the day when the flies attracts, as soon as animal dies, it attracts to the animal, and these blowflies, they lay the eggs. They lay plenty of eggs in the orifices of the dead body, and these flies these eggs hatches within 1 day, approximately 23 hours, and there will be larva emerges from the eggs, and these larvae will take 3 to 7 days. They grow to first stage, second stage, and the third stage. So after third stage, and they go into pupa stage. So the pupa stage will be 8 to 9 days. So next, after 8 to 9 days, the pupa will they become the flies, and the flies emerges out of the pupa. It will take 2 weeks to emerge the blowfly from the cocoon. So this is the in these stages, if you collect the maggots or pupa from the, or even though the cocoons, so which the flies are emerged, they flies also the cocoons are there, the open empty cocoons. So in such cases also we can identify the time of the death. Next one. And the carcass decomposition process after death. There are 5 stages of the carcass decomposition process. First is the fresh stage. That is 1 to 2 days will be the fresh stage. So which begins at the moment of the death and ends when the bloating of the carcasses is observed. Then second stage is the bloating stage. That is day 2 to 7. This is the bloating stage. And here the putrefaction starts. And the third stage is the decaying stage. Here the putrefaction completes, and 5 to 13 days. And third and fourth stage is a post-decay stage. So it starts from 10 days to 23 days, where in this stage, the Diptera larvae, we have seen that flies, the primary flies, they start leaving these carcasses at this stage. So post-decay stage. So they leaves the behind the bones, cartilages, hairs, and small portion of the tissues, and also large amount of the wet viscous material known as the byproducts of the decay. So these byproducts of the decay is a major site of arthropod activity. From here, the beetles, arthropods, they start eating on these byproducts of the decay. Then remain stage. So it is from after 23 days up to 90 days up to 3 months. So this is called a remain stage. In this stage, it is characterized by bones with a little cartilage remaining, and BOD has dried up. Next one. So these are some of the instruments used in the postmortems. So as you know. Next one. So here this is the actual postmortem procedure. So here we how we go with the postmortem procedures. So till now we discussed about so what are the how to what are the steps to be taken and how to identify the time of death and all. So this is the actual postmortem procedure, postmortem examination. So first we have to know the history of the management or the history of the death animal. So here collect the information on clinical disease or treatment or previous ailments in case of a captive or wild animals. So information should be collected on the circumstances under which the disease was contracted by the animal and also the symptoms shown and also diagnosis that may have been made. And also the particulars should be also obtained so from the treatment received by the animal and mode of its death. Next one. So once we get the history of the animal, then we'll go for the external examination. So in the external examination, first identify the sex of the animal and also note the position of the carcass and note the carcass condition. So how the carcass condition is, whether the carcass is fresh or as we discussed the 5 stages of the carcass and also see the any dislocation or any fractures of the long bones and any signs of putrefaction and also examine the skin for any parasitic infestations in case of any fresh and also see the if there is any lesions on the body. So is there any edematous swelling and also is any crepitation under the skin and is there any injuries or any burns on the body. So and also whether visible mucous membranes are paler, congested or cyanotic or inflammatory. So all those things we should know in the external examination. So and also examine the skin for swellings. So and also for any wounds and also the eruptions and also cutaneous filaria or any warts. Next one. And also examine the signs of injury by the bullets or infighting or mauling by any large carnivores. So especially in the captive elephants, look for injuries inflicted by the mouths. So and also examine the fresh dung droppings and also collect the dung from the rectum and you examine it and it will give the indication of the teeth conditions. So and also inspect the natural orifices for any discharges and also for the oral cavity if there is any lesions like a foot and mouth and or etc. And also examine the temporal glands for the must in case of the elephants. Next one. Once we examine the external body surfaces and we'll move on to the internal examination of the body. First examine the head region. So this is a sequential examination, head region and forelimbs and the hind limbs for any injuries and head as we know that any mucous membrane change, congestion or any other changes and legs for any injuries, edema, swelling, so any fractures. And third one is we cut off on the thoracic cavity and we'll examine and later on the abdominal cavity. In these two cavities and we'll examine the organ one by one. Usually the major organs in thoracic cavity is lungs and the heart and abdominal cavity and we can examine the intestine, stomach, liver, spleen and other kidneys and other organs. So first we examine, we see the actual location and orientation of the organs in those two cavities and also a relative size and shape of those organs. And if there is any abnormality, then we should note down those abnormalities. And presence of abnormal fluid in this body cavity should be noted and examined. And also the odor emanated from any organ should be noted. And nature of the content in hollow organs like intestines, so should be noted. Next one. So once we conduct the postmortem examination, once we complete this postmortem examination, and we'll see so cause of death. So during this cause of death, so it attributed to failure of any one of the cardinal pillars of the life. That is, it could be heart and it could be lungs or brain. So if you find any lesions, any lesions, so I have mentioned here. During the lung failure, you may find the cyanosis of the face and the neck. and also extravasation of the blood beneath the conjunctiva, and right ventricular dilatation and filled with the blood, and left side of the heart contracted and it is empty, and lungs are congested and spleen is contracted. If you see any kind of these changes, and you can suspect for the lung failure. And second one is heart failure. So during the heart failure, you can see the pale carcass, and also heart contracted and heart is empty. So this is the lesions you observed in the heart failure. And third one is brain failure. So in such cases, hemorrhages in the brain and also infarcts in the brain can be seen. Next, ma'am. So apart from these lesions, so you also come across some special cases such as electrocution. So how to find out, identify the electrocution? So it is the effect, the electrocution effect is depends on the strength, duration, and effectiveness of the current. So here mainly death due to ventricular fibrillation or vagal inhibition. So here electrical shock, the current marks are crater-like ulcers which are seen on the body and which are resistant to the decomposition. Even singeing of the hairs, so where the wires are contacted, so can be identified, and also singeing marks, burning marks on the body can be identified. And the endocardial hemorrhages, so it is very evident, and also hardening of the brain. It is a very important point to be noted during the electrocution, and also petechial hemorrhages in almost all the serous membranes will be seen in the electrocution. And also anoxic changes, and also when vertical fractures of the lung bones can be seen in the electrocution. So if you find any of these kind of things along with the history, so you can suspect it for the electrocution. And also lightning. So if you see the right side again on picture, so there are 300 wild reindeers killed in lightning in Norway in few days back. So this is the effect of the lightning. So this is a tree-like redness lines on the body can be seen, and lacerations, and also concussion, because so it is a at the site of the entry and exit can be seen, and singeing of the hairs can be seen, brain hemorrhages and hemorrhages in the subcutaneous tissue. So these kind of lesions will be seen in the lightning. Next one. So next condition is heat stroke. During the heat stroke, so most hemorrhages seen in the visceral organs, and also edema in the brain and edema in the lungs, and myocardial hemorrhages. These are the common lesions seen in the heat stroke. And finally, the gunshot wounds, circular clean hole, so inverted edge at the point of entry, and large hole with a everted and a rugged border at the exit. So if you find these kind of lesions, so it is a gunshot wound. And also hemorrhages in the internal organs, it is also along with these kind of lesions, so penetrated wounds, so you can suspect for the gunshot wound. Next, ma'am. And once you conduct the postmortem examination, suppose you suspected for any poisons, so and what are the contents and how much to be collected. So this slide shows, so around 200 to 500 grams of stomach content should be collected if you suspected any poisoning, and it could be intestinal content or stomach content, or 200 to 300 grams of liver, or 100 to 200 grams of the spleen, so 100 to 200 ml of the urine, and if you collected any organ, kidney, one kidney will be collected. Next one. Next one. So once you completed the postmortem examination, it is very much important to waste management. That is, we are used so many PP kits, so some other waste solid materials. So there's a non-animal solid waste. So how to dispose this kind of wastes? So it could be decontaminated by autoclaving. So if it is reusable, can be used again. and also some liquid biological waste may be flushed down by the drains, and this will be disinfected later on. And also methods of waste management. One is a sanitary landfill, and second one is a rendering. Third one is a incineration and burning. So fourth one is a deep burial. Next one. So this is also very important. Cleaning and disinfection of the postmortem room. So once you complete the postmortem examination, so it is a highly infectious materials. They are spreading a spillage over the surface of the floors or walls of the postmortem room. So it is very important to clean the postmortem room. So here equipments must be cleaned thoroughly with the disinfectants, and drains must be flushed with warm water and disinfectant as well. So here some of the reusable PPE can be must be disinfected and air dried and left in the room itself. So the type of disinfectant used in the postmortem room, so these can be used like phenolics. These phenolics are generally very good disinfectants for the most of the bacteria they act against most of the bacteria. And alkalis, that is a lime and sodium carbonate, so they used for this anthrax and clostridial spores disinfection. And also some chlorinated compounds, so hypochlorite and sodium hypochlorite, and chlorinated lime and quaternary ammonium chloride and chloramine. So these disinfectants can be used for the disinfection procedure after postmortem examination. Next one. See, this is a scientific disposal of the carcasses after postmortem examination. So as per the Government of India guidelines, so it is a responsibility of the veterinarian, so to ensure the proper disposal of the carcasses after postmortem examination. So either it could be burial or incineration, so based on the feasibility and also based on the recommendations. So first one is if you want to bury the animal, so the pit should be at least 250 meters away from any drinking water source. Okay, and the pit should be bigger than the animal size, and all parts of the carcasses should be buried completely in the pit. Okay, and disposal by the incineration. So there are two types of incineration. One is by some open method and the closed method. Next one. And some of the safety precautions should be taken during the postmortem examination. So first one is unauthorized persons are not allowed within the necropsy hall. And second one is the personal belongings must be stored and secured outside the necropsy room. Okay, and individuals should not work alone in the necropsy room. There should be more than two people should work in the postmortem room. Food and drinks of any type it is not allowed in the necropsy room, and motorized tools will not be used during the necropsy. So except some cases, otherwise it should not be used. And PPE must worn at all the times during the necropsy, and N10 respirator so must be worn for the avian or rodent necropsies, especially the avian influenza, so and other some rodent necropsies. And protective earwear should be used where the ocular exposure is possible, and special precautions must be taken with sharp items, and also perforated or split gloves should be changed frequently, and also wash the hands thoroughly, and PP must be removed and either disposed or disinfected, and hand wash with a soap and warm water is required before exiting the necropsy room. Next one. So these are some of the references used for the preparation of the PPT. Next one. Next one. Thank you for your patience.
Well, thank you so much, sir. So now we have some of the questions for you, and these questions are as now. So how would you confirm the particular species of the animal after getting a cooked piece of meat in the forest?
Uh, that will be confirmed by species identification, madam.
Okay, sir.
Extracting the DNA from the cooked meat, especially the core of the cooked meat, that the DNA is very much useful. And after extracting the DNA, it can be amplified, and after sequencing the, or if you know any one or two species, and directly you can go for species specific primer, or if it is not knowing, so you can go for the universal primer, and after sequencing you can identify the sequence can be used in NCBI website to match or blocks, and you can identify the exact species of that meat.
Thank you, sir. Another question to you. In case of Schedule 1 animals, if the carcass is found to be unfit, what should it be? What should be our action? If I don't go for PM, what shall I show as a probable cause of death?
In such cases, madam, the cause of death would not be determined, but based on the history available, and we can give a report saying that though it might be cause of, because in such cases usually the infection will not be retrieved except in some cases where in salmonella, if the infection is in the bone marrow, in such case we can identify. Or in case of advanced cases, we could not find any lesions, and also if you collect the samples, in such cases the contamination is a very high, and you can't come into conclusion that the animal is dead because of this reason. In such cases, so it is very difficult to say the cause of death, but based on the history, and you can give the report, ma'am.
Okay. Thank you, sir. Another question, last question is what about use of motorized tools in necropsy of elephants or other huge body mass wildlife?
Yes, ma'am. Usually, motorized tools should not be used in small animals, but the large animals like elephants, we have seen and also we have used in some cases. But the problem is, the when you're using the motorized tools, the precautions should be taken to, because spillage is a very much, and also it's a very important to take care of all other precautions while using these motorized tools now.
Okay. Thank you, sir. Thank you so much for a very wonderful presentation and for your time also. Thank you so much, sir. Thank you so much on behalf of our Mysore Zoo. If any other questions, the viewers can post it in our live chat and we'll get back to you with these questions. So, thank you so much, sir. Tomorrow, thank you, viewers and participants. So, tomorrow we have another session at 12 o'clock by Dr. Gauri Malapur, and she would be delivering her talk. So, I request all the viewers as well as the participants to please visit Mysuru, MYSURUZOO hyphen SCZG YouTube channel, so that tomorrow you can view the live session of Dr. Gauri Malapur. Thank you once again and have a good day.